Hello, hello, hello. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network, and it is time for another support group meeting. Although this is a holiday weekend, and so who knows if people don't come, that's fine. I have things I can do. So, my purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I want you to be able to walk into your doctor's office confident, prepared, ready to ask the right questions, ready to walk out of that appointment with a plan, a treatment plan. We want you to understand why you're struggling with symptoms, number one. And then number two, what are your treatment options? And we always start with the easy stuff before we get to the hard stuff. Hello, Tabitha. It's nice to see you. Hi, Lisa. I wasn't sure if people were going to be around today since it is, at least here in the US, a holiday weekend. Hi, Nancy. Nice to see you. Okay, let's see. Hold on a second. Got to get my computer all set up correctly. Hello, YouTube. It's nice to see you. Hi, Donna. Hi, Chris. When is the Zoom going to show up? The Zoom will be starting at 2 o'clock. Right, or earlier. We'll see. Hello, Stacy. It's nice to see you. So we're simulcasting live on Facebook and YouTube. If I'm looking up here, I'm looking at Facebook. If I'm looking down here, I am looking at YouTube. So let me just get things straightened up here. There we go. And we're pretty good. It's looking pretty good here. Allison says, I'm using the Healy frequency device and my bladder is calm. What is that? I haven't heard of the Healy frequency device. Let's pick it up. Hello, Julianne. Hi, Tamara. Hi, Carla. Hi, Pauline. Hello, Sarah Lou. Hello, Suri. Hi, Arlene. Suri is having a flare right now. Well, dang it. You tried some baking soda. Sarah is 7 weeks pregnant. Congratulations, Sarah. That's fabulous. I absolutely wish you well. Julianne says, I've been flaring for the past few days. Pauline says she's in a flare right now. What's a Healy frequency device? I don't know what a Healy frequency device is. Let's look it up here real quick. Hold on a sec. I'm wondering, it sounds like it's probably some sort of neuromodulation device. There are a couple of different, we're kind of long past the days of Medtronic's InterStim. Now we have other devices that have been tested and that are currently being used, not only sacral neuromodulation, pudendal neuromodulation, but also ankle post-tibial nerve stimulation. And now they have, rather than just using an acupuncture needle as the vector to the nerve right above the ankle, they actually have a little implant now that's kind of looks like a needle that can be used. The first research study came out with that a couple of months ago, which showed that it was pretty good. However, we do always want to remember, we got to put therapies in context here, my friend. Number one, we got to know what we're treating. And number two, we have to understand the risk versus the benefit ratio, right? Right. And so anytime you're going to have a surgical procedure, you're running into, or any sort of invasive procedure, there are going to be potentially more risks of side effects. That's why in the American Urology Association treatment guidelines for IC, they have 6 steps of treatment. So in step 1, they want you to do all the super easy stuff that we know it doesn't come with a lot of risk, as compared to step 6, which is surgery, which potentially is irreversible. So normally you start with easy stuff and then you move your way up until you find relief. So hold on. Healy, let's see what that is. Frequency device? Okay, well, here's a review. What is it? It's a wearable device. Healy is not intended to diagnose or treat any disease, including COVID-19. I've never heard of this, guys. So you and I, we are all learning about this together. So let's see what this website's healyshop.com. They have a watch, they have apps, adhesive electrodes. Looks like it's kind of just a a fancy 2020 neuromodulation or TENS unit. So it looks like to me, it looks like it's more of just a TENS unit. Healy is a microcurrent medical device that has been cleared by the US FDA for acute, chronic, and arthritis pain and muscle soreness due to overexertion. Healy also has non-medical applications that use individualized frequencies to help balance your mind, body, and relieve stress. Always use in accordance with its instructions. All right, so this has never been tested with interstitial cystitis. I'm going to tell you right now. So I'm certainly not endorsing it because I've just heard about it myself, but it is interesting. You know, if you look at the American Urology Association guidelines, in step 1, what do we have? We've got uh, acupuncture. And this could be kind of a variant of acupuncture. We've got diet modification. We've got over-the-counter supplements. We've got water intake. As long as it doesn't have the potential to do damage, and if there is at least some research which shows that it might help relax muscles, that's good. I don't know anything about it. I will look at it after this meeting and see what we have to say. Sarah says, is there anything I can take with bladder spasms, bladder pain, and being irradiated as I'm pregnant? Sarah, you know, over on our website, icnetwork.org, we have a pregnancy resource center. I would encourage you to go to the pregnancy resource center and check the resources that we have over there. In particular, Dr. Deborah Erickson at the University of Kentucky published the only paper that talked about IC therapies within the context of pregnancy and rated their safety. And so obviously we want to avoid anything during the first trimester. That's critical for fetal development. But after that, there may be some things that they may be able to do, but you've got to start with the hardcore research. As an example, one of the things that she talks about in that article is bladder installations. That yes, maybe a heparin lidocaine installation might be viable to reduce bladder pain. However, she specifically does not recommend the use of sodium bicarbonate in that installation because that would help it cross your skin, penetrate more deeply into tissue, and potentially deeply towards the fetus. So, girl, you go over to icnetwork.org. Please go to our Pregnancy Resource Center. Check the link for that article. You need to buy that article. We don't have it. We don't sell it. The journal owns it. But really, seriously, you need to spend the 20 or 30 bucks, buy the article, read it, and give it to your doctor, okay? Obviously, diet modification is going to be really important for you right now because your bladder is going to be has the potential of being more sensitive to food. Now, interestingly, with pregnancy, what's fascinating about pregnancy is about half the IC patients who get pregnant, their symptoms go away, and it's very cool. The other half, their symptoms seem to get a little bit worse. But what I can tell you is that IC patients have had thousands of pregnancies extremely successfully. I think you are going to be a fabulous mother. I think you're going to have a wonderful pregnancy overall, but you're going to be working at it now. You're going to have to really be diligent here with your diet, with water intake. You have to talk to your doctor about your prenatal vitamins because some vitamins might be a little bit more irritating for your bladder, okay? But anyway, icnetwork.org, go to our Pregnancy Resource Center, and that should give you a few more tips. Deanna says, I've been having a flare for the last week and bladder installations have been canceled. So what can I do to ease the burning? I've missed 3 treatments because of the pandemic. Will D-Mano-Cell? All right. So my friends, now listen here. We cannot have a good discussion about treatments until we understand the type of flare you're having. Because you can have a bladder wall flare from, say, having a margarita on the 4th of July. Some of you are probably flaring right now because you had a little bit of fun yesterday. But you can also have a pelvic floor flare from a long car ride or from sex. Or you could be having a hormone flare when your hormones get a little funky. Or you can be having a stress flare, where when you're under periods of high stress, you know, that causes your nervous system to become a bit more sensitive, to release more irritating neurotransmitters. So, Deanna, question number 1 is, what do you think triggered this flare? What do you think triggered this flare? Go back a week. Anything that you associate with this? Now, the second thing we have to consider, one of the ways we can kind of try to figure out the type of flare you're having is, when is your pain the worst? Is it the worst as your bladder fills with urine, or is it the worst after you're done peeing? So if your bladder gets worse, if your pain gets worse as your bladder fills with urine, then that points us to the bladder wall. If your pain is worse after you're done peeing, that points us more to your pelvic floor. And you specifically talk about burning. Now, burning is actually more of it can be two things. If it's a deep vaginal burning, we're really looking at pelvic floor spasms, because a muscle that's working hard is a muscle that builds up lactic acid, and lactic acid hurts. If you were going to go run around your block, or go run for a couple of miles, eventually your legs would start burning. Why? Because the muscles are working hard. Muscles that work hard build up lactic acid, and that burns. So that burning sensation we really associate more with the pelvic floor, unless you have burning as you're peeing. So literally, as you're peeing, your urine feels hot and it feels like it's burning your skin. That is usually a statement about the quality and health of your skin, specifically your vulva and your urethra, and that could be a sign of estrogen atrophy. Let's see here. Hello, Deborah. Hello, Melody. Allison says it's working. Good for her, girl. I say go for it. As long as it can't hurt you. I just don't have any data or any information yet that it's helpful with IC, but I'm really glad that it's helping you. That's fabulous. We'll have to write an article on it. Sarah says, I have endometriosis and pelvic floor myalgia along with IC. I am in a huge pelvic pain flare during my period. Are there any resources that shed light on IC as it relates to hormones? It's hard for me to tell sometimes what the root cause of my pain is and how to address it. Okay, so it's completely normal to flare during your period when you've got endometriosis. And Sarah, the real question here is there endometriosis that's attached to your bladder? Do you have any insight on that? Because, the challenge with endometriosis, my friends, is that it's uterine tissue that's migrated into the abdomen. It's migrated into the belly, and it can go throughout the belly. So it can not only attach to the bowel, it can attach to the bladder, it can attach all over the place. It can move up around your intestine. It can go up towards your stomach, and it has even gotten as far as by your lungs in some patients. Granted, that's pretty rare. The problem with endometriosis is that endometrial tissue will bleed. It will bleed, and it's quite painful. We don't normally have open blood flowing in our belly. That hurts. Blood is supposed to be contained in a vein or an artery. And so when you've got bleeding in your belly, that it's really quite provocative and quite irritating. And so it doesn't surprise me that you're flaring with endo. For some people, there is, when we consider the subtypes of IC, remember we've got these 5 core variants of IC, and then we've got these little subtypes. There is absolutely, and I've said this before in other meetings, I absolutely believe that there is a small subtype of people who are very hormone dysfunctional, very hormone driven. Because I've worked with you guys for years, and I know that there are patients out there who, once they finally got their hormones stabilized, they felt much better. And so working with your OBGYN, getting your hormone levels tested, making sure that you're not wildly out of balance in some way or the other, I think is really important for patients who find that they struggle intensely and severely with their periods. Other than that, Sarah, I'm sorry to say that we don't have a lot of research on the influence of hormones on IC flares. We really have more just a lot of anecdotal data from patients. Rebecca says, is anxiety tied to IC? Absolutely. Absolutely. Anxiety is a very strongly related condition to IC, and really for 2 reasons. I mean, reason number 1 is whenever you're in pain, you're anxious, especially if it's undiagnosed. Just like, God, please tell me what's wrong with me. And it's completely normal. It's completely normal to feel anxious when you're dealing with a medical condition that's painful. especially if you're working through diagnosis and you're trying treatments and you feel overwhelmed and you're not sure what to do next. And God forbid you come online and start reading bad stories about patients who are suffering. Of course, that's going to produce some anxiety. But anxiety is also balanced with information, right? And our goal here now is to try to teach you as much as we can about the anatomy and physiology and the physicality of IC so that information will start removing some of that anxiety. The other place that anxiety seems to be common is in IC subtype 5 central sensitization. These are the patients who have a very, very sensitive nervous system. I'm one of those patients. I certainly have had anxiety from elementary school on, for a number of reasons. I mean, for a number of very, very legitimate reasons. Why does it always get hot in my office when I start these chats? Hold on, let me turn on the air conditioner. You guys tell me if you hear that air conditioner, I will turn it off, okay? So if you've got central sensitization, like I do, IC subtype 5 in the Chris Payne subtyping system, people with central sensitization, we got super sensitive skin, right? We tend to be drug sensitive. We tend to be food sensitive, not just for our bladders, but our whole bodies. We don't do well with food. We tend to have a wicked sense of smell. We can smell things that other people cannot smell, and smells tend to drive us crazy. We have a lot of chemical sensitivity. And in that vein, we seem to also be pretty sensitive to adrenaline. And that when we have a lot of adrenaline circulating through our body from stress and anxiety and being startled and classic catastrophic thinking, there is a fabulous anxiety management program called Phobies that talks about anxiety being driven by a sensitivity to adrenaline and too much adrenaline. Over on our website, icnetwork.org, in our Living with IC video series, I have a video on anxiety and IC that I hope you'll watch, because I talk about that anxiety management system. And I will tell you that it changed my life when I took the Phobies program, and I have not had a panic attack since I took that class 25 years ago, even in the face of uterine cancer and unexpected surgery. I was doing my anxiety protocol in the car. So please come on over to our website, icnetwork.org, and watch that video. Hello, Karine from Belgium. Sarah says, she had her endometriosis removed from her bladder before. My last excision was 3 years ago by a specialist, and he keeps telling me that the recurrence rate for him is at less than 5 years is 0. Well, I guess the proof is in the pudding, and that is, would a sonogram show that you've got any new tissue? John Lee, and it's not John. I'm sorry, I've forgotten your name. I apologize. Loretta, thank you. If I just finished reading your thing, I would have seen your name. What should we request in hormone testing? They usually want to just totals. Hun, I don't really know. I'm not I just haven't done enough research on it to tell you what the right test is. That's where you really have to talk to your doctor. Lauren says, anxiety tightens my pelvic floor, which squeezes my bladder. Absolutely. When you are anxious, when you are startled, the fight or flight response does a number of things, including it prepares your body to fight or to run, and it will redirect blood flow from your core out to your muscles to get you ready to run or to fight. And yes, anxiety, you will subconsciously tighten your pelvic floor muscles. Kirsty says, I cannot eat cherries. I also saw a specialist and she thought I may have had IC, but the bladder scope could not determine. After a while, I went to a GI doctor. He put me on a low FODMAP diet. He explained that intestinal flare inflammation could feel like the bladder is causing it. Yeah, that's absolutely right, Kirsty. That's absolutely right. I can show you. Hold on, let me grab this picture. There's something called neurocrosstalk. And in neurocrosstalk, what that means is nerves proximal to other nerves are communicate. They communicate. And what makes the pelvis all the more interesting if you look at this picture right here, this is basically a picture of all of the nerves in the pelvis that all combine at the spinal cord. And this is where we see a lot of crosstalk right here. That's why we knew 15 years ago that in studies that if the bowel were irritated, the bladder would show signs of irritation. If the bladder were irritated, the bowel would show signs of irritation. And that is indeed because of the proximal nature of these nerves and how they merge at the spinal cord. They've done radioactive tracer studies where they put a radioactive tracer in the bladder and they put radioactive tracers in the bowel and they watch them. And what they found is that they merged in nerves right at the spinal cord. And that is why the bladder and the bowel are so incredibly interconnected, and as well as the muscles, et cetera, et cetera. Lauren says, pelvic floor therapy helps. Yeah, it helps tremendously. Monica says, has anybody ever tried hyperbaric oxygen therapy for IC? That's a good question. Anybody here try it? Yeah, I mean, the research shows that it can be quite good, especially for patients with Hunner's lesions. Anybody here try it? Eileen says, flaring terribly right now. Tried so many things, nothing is helping. Okay, so again, Eileen, our goal here is to try to figure out what kind of flare you're having. So when is your pain the worst? Before you pee or after you're done peeing? And let's work through that flare management protocol here. You guys, if you come on over to our network, to our website, icnetwork.org, and you sign up for our newsletter, there'll be a pop-up window that will come up, or you can do it right from Facebook. If you sign up for our free newsletter, you will get a 40-page flare management guide. 40-page flare management guide that you can download and read. And I talk in that flare management guide about the types of flares you can have and then give you hour-by-hour rescue plans. Amy says, definitely had both intestinal and bladder issues together my whole life. Yeah. Jennifer says she's trying to sort out her subtype and she's coming up short. Do you know if there's any connection between acid reflux and bladder pain? You know, all of my bladder trouble started after taking PPIs for 6 months. Isn't that interesting? I will tell you that a lot of IC patients, if not the great majority of IC patients, have reported a variety of stomach issues. We don't necessarily understand why. I myself have had several bouts of gastritis and have been diagnosed with gastroparesis. I was just working with a patient on Friday, same thing. She's got gastroparesis too. When you got gastroparesis, that means delayed emptying. It means that food sits in your stomach longer than normal, and that food will start to ferment. And as it ferments, it produces gas, and then you start belching. Your stomach feels very, very full. I know for me, what was driving that was leafy greens. As long as I don't eat any leafy greens, I'm fine. If I eat lettuce or spinach or kale, I will have stomach distress for hours and hours. I eat lots of salad. I just don't eat greens. I eat carrot salad, cucumber salad, all sorts of salad, beet salad. I made a fabulous cold beet and avocado and carrot salad. It was really good. Lynn says, my insides are always in pain and swollen. I have endo and fibro as well. I look 9 months pregnant every other day. I hate eating because I don't feel like I ever digest. Ooh. So, Lynn, it would be very, very interesting for you to maybe read about the FODMAP diet, FODMAP, FODMAP diet. The fact that you are feeling distress, gut distress when you're eating points to the fact that there may be something that you're eating that's bothering you. I would never have guessed for me that it was lettuce. And yet, how many times did I get sick after eating a salad? Many, many times, both IBS and stomach. And for me, my body just doesn't tolerate leafy greens well. Even if they're chopped up, I still can't eat them. I still get a lot of gas from them. It sounds like if I were you, I would also spend a little bit of time reading about bowel disorders and then making an appointment with a gastroenterologist or an IBS specialist and see what they've got to say about what's going on. And take some time to read about gastroparesis. That may be what you've got if you feel like you're not digesting and is sitting in your stomach for a long period of time. Hello, Sherry on YouTube. Hi, Chris. Hello, Donna. I already said hi to you, Donna, but hello again. Hello, Patty. Patty's, what's the anxiety course called? The anxiety course that I took was called Phobies, like phobia. Ease, EASE. You can still buy some of the very old course materials on Amazon. Guys, this is 25 years ago, well before the internet. They're not fancy at all, but it's just an absolutely fantastic course, in my opinion. In fact, the doctor who created it was a surgeon who created it for his son, who also had anxiety. Tamara says, question I've been wanting to ask. Can having a lung nodule ever be connected to having IC? I don't think so. Wow, girl. This is Tamara. Tamara says, can having a lung nodule ever be connected to IC? My answer is no. I don't believe so. I'm having a PET scan on Tuesday. I'm scared. I've never smoked. This was found last fall and grew from 5.7 to 8.4 out of benign breast cyst removed a year ago. My body loves to be dense and fibrous. I have central sensitization. Some of my IC is from your right pelvic floor. Okay. You have anxiety, yeah. Hypothyroidism, me too. IC, allergies, me too. Asthma, yes. Acid reflux, occasionally. Osteoarthritis. I don't know. I don't want to swear, but look at this. This just happened. I'm trying not to flip you guys off. You see my joint right there? That's new. I just noticed that. Like, what the heck is that? Obviously, it's some arthritis. Weird. You're 55. They've already done a CT scan, only found one nodule plus a couple of gallstones. I'm trying to fit all the puzzle pieces together. I love your saying we are all an anatomical mystery to be solved. So again, Tamara, I just don't know of any connection between the lung and the bladder other than blood flow. I mean, I hope that you'll send me an email or give me a call after you have your PET scan. Love to hear what's going on with you. I mean, I totally relate to the whole breast, the thick, heavy tissue, dense fibrous tissue. Stacy sent me 200 stars. Thank you, guys. Thank you. Hey, listen, if you find these meetings helpful, you can send us stars on Facebook. But what I'd really love for you to do is sign up and get our magazine, the IC Optimist. There's a sample right there. Because number one, it is something that we write 4 times a year specifically for IC patients. It's read by thousands of people, including doctors. We feature IC experts. But my goal with all of our publications is I want you within 5 minutes to learn about something, read something that you might be able to try. So they're very patient-centric. So if you find these meetings, please consider becoming a member. Come on over to the IC Network. Up at the top of the page, there's a little link that says become a member. That would be fantastic. Eileen says, bladder feels full. Okay, your pain is worse before you urinate. Your bladder feels full constantly. Every 5 minutes, I'm getting up to use the restroom. Okay, so guys, let's talk about a flare for a moment. Let's talk about a flare. So again, we've got our 5 subtypes, right? So we've got Hunner's lesions, bladder wall driven, pelvic floor driven, neurologically driven pudendal neuralgia, and number 5, central sensitization, right? So obviously, the bladder, like any other part of the body, can be injured. There's no doubt about that. And generally, the bladder is injured through some sort of chemical exposure, like chemotherapy. So we see patients with chemotherapy going through chemotherapy will have chemo-induced cystitis, frequency, urgency, pressure, pain. Or people have had a terrible diet, or people who have been exposed to ketamine. You have to remember that your bladder was not built for life in 2020. Your bladder was designed tens of thousands, hundreds of thousands of years ago, when acid was not a daily reality in living things. The only time we were exposed to acid 1,000 years ago or 2,000 years ago was when fruit was ripening but out of season and somebody ate some of that fruit, right? And so today's massive acid load is brutal because simply our body isn't designed for that. A lot of that has to do, though, with your lineage, because for me, I come from Norway and Sweden, specifically northern Norway and Sweden. We're talking Arctic Circle, my friends, Arctic Circle. And so for my ancestors, there was no fruit other than berries once a year, maybe apples. That's it. So my body has never really had the opportunity to adapt over time to create defenses for a lot of acid, as compared to somebody whose ancestry is around the equator, where you might have had fruit year round. The odds are your body is much better at tolerating acid than my body, because for tens of thousands of years, your ancestors were eating it. So why do I bring that up? Well, let's talk about a flare, a bladder wall flare. Generally, a flare, you will often feel your flare at night, right? So during the day, life is going on, you're fairly occupied, you're not necessarily paying attention to your bladder at first. Then you get ready to go to bed, you pee, you go to bed at, let's say, midnight. You wake up at 1 o'clock in the morning, your bladder feels very, very full. You go to the bathroom. You pee out maybe a quarter of a cup of urine. You go back to bed. 30 minutes later, your bladder feels very, very full. You get up, you go to the bathroom, you pee out maybe a teaspoon, maybe a tablespoon. That's it. You go back to bed. You wake up 15 minutes later, if you've even fallen asleep. Your bladder feels very, very full. You go to the bathroom, you sit on the toilet, nothing comes out, and then you start pushing and you might get a drop or two. It is a false sense of fullness. Your bladder feels full even when it's empty. Why? To me, that tells me that your bladder wall is profoundly irritated. That's extreme bladder wall irritation. So now I got to figure out what's irritating it. So you get to look back again at your day. Was there something that you did? Are you taking a multivitamin every day? That would do it. Are you drinking coffee? That could do it. Are you drinking Diet Coke? That would do it. Are you taking a multivitamin? That would do it. Did I already say that? I might have already said that. Okay, you taking a B6 or vitamin C or something like that. So we want to look first at, could you have been exposed to some sort of irritant that's triggering your bladder wall? But listen, Eileen, if you're peeing every 5 minutes, that means that something else could be going on. I mean, that's really, really extreme. And so the next step to me would be a home UTI test. And let me just see. Here we go. In my opinion, every IC patient should always have some of these on hand. They're azo test strips, or you can go to Walgreens, and Walgreens has their own test strip. If you're peeing every 5 minutes, we have to consider the possibility that you could have infection. And so with a UTI kit like this, you basically just pee on a little stick, and with these kits, so here's the stick right here, right? It's got 2 little pads on it. The top pad is for leukocytes. The bottom pad is for nitrates, right? If you have a double positive, if you have a positive nitrite and a positive leukocyte, that means there's blood in your urine, and nitrites are produced only by bacteria. It means you got a bacterial infection. You got to call urgent care, call your doctor, get your urine tested. We also want to rule out a fungal infection. Unfortunately, this is just preliminary. This can have lots of false positives or false negatives. So obviously, if you're scared, if you're in distress, if you're peeing every 5 minutes, if you're peeing blood, you call your doctor. Like seriously, call your doctor and get your urine tested just out of curiosity more than anything else. Eileen, I guess my other question for you would be, again, can we go back in time? When did this start? When did this start? Was there any event that you associated with the onset of this flare? Michelle says, I've been in worse pain and new symptoms after my last installation. All right, Michelle, what kind of installation did you have? There are lots of different potential installations. What did they do? Fern says, I'm scheduled for physical therapy next week. I'm worried every time I get an internal exam, I'm in terrible pain for a day, and you're now taking NSAIDs for spasms. Fern, now remember, I think we talked about this. You have to understand and respect the fact that your pelvic floor could be triggering bladder symptoms and vice versa. We know that a painful bladder will change your muscles. It will make your muscles tight. That's called the guarding reflex. That's also known as a viscerosomatic reflex. We also know that tight pelvic floor muscles can do other things. Tight pelvic floor muscles can affect your bladder. So if you've got tight muscles, that's restricting blood flow to your bladder, that's restricting nutrition to your bladder, it's potentially compromising nerves, compromising all sorts of things. And of course, you have no clue that you have a muscle injury. Your first symptoms are frequency, urgency. You think you've got an infection. You go to the doctor. The doctor says your urine culture is negative. They throw antibiotics at you anyway. They don't work. Then they say you have overactive bladder. They throw overactive bladder medications at you, and they don't work. You go back to the doctor. The doctor says, well, you must have interstitial cystitis. They throw IC meds at you, and they don't work. And at some point in time, we have to accept the fact that bladder therapies will not fix tight muscles. Tight muscles require muscle therapy. This is about restoring blood flow. There's no pill that's going to fix a muscle that's dysfunctional. I mean, it might give you a muscle relaxant like baclofen or Flexeril, but working with those muscles, retraining those muscles is remarkably successful, proven in research, in a research study presented on IC and pelvic floor physical therapy in 2008. So don't be afraid of the physical therapy. Number one, they're not doing a speculum. Number two, you are actively involved in that appointment. If they do something that hurts, you go, ow. Get them to back off. But as I've said before, if you go to a pelvic floor physical therapist for the first time, understand that their job is to study your body. They're going to study your body. They're going to be looking for muscle tension patterns. They're going to measure your legs. You have one leg longer than the other. They're going to watch how you walk. They want to see if you're walking normally. They want to see, is your pelvis level? Is your pelvis tilted, etc., right? And they will do an internal examination. And in that internal examination, they're going to do shallow muscles, they're going to do medium muscles, and then they're going to do deeper muscles. And all they're going to do is just gently touch. So here's your pelvic. They're going to put their finger in, and they're just going to gently touch muscles, right? If that triggers pain, that is a tremendous success, hallelujah moment. You know why? Because it means they found it. They found it. They found it. That's exciting. That's great news. When that happens, your job is to go, okay, that's it. What are you doing? What are you touching? You have to understand what they're touching. Is it your piriformis muscle? Is it a levator muscle? Is it an obturator muscle? Is it whatever? We have to figure out where the problem is. Remember, your bladder is very centered, right? So look at it this way. All right, so look. See, I should just be wearing a bikini, except I don't want to show it to you. I don't. Okay, hold on. Okay, so look. So here's my legs. My bladder is right here, right? If you have pain directly under your belly button, then that's centered to the body. So that helps us understand that it could be bladder pain. But if you've got pain to the left or to the right, or if you only have pain on one side, that's the mystery. What is that pain? You know, remember, you can have pain that's low, that versus high, left to right, inside versus outside. Your ability to describe where your pain is, what makes that pain better, what makes that pain worse, is critically important here. It's critically important here. Jillian says, I saw this and wonder if this is true. Have you heard of a parasite related to IC? Well, okay. You are an anatomical mystery to be solved. The bladder can be injured in many, many ways. The pelvic floor can be injured in many, many ways. There is not so much in the United States, but in other countries, tuberculosis can be in the bladder. So can schistosomiosis be in the bladder? Maybe, but at least I don't know if they've found, you know, in 27 years, I've been to almost every IC conference. They've never found a worm in the bladders of IC patients. Hold on. You know, okay, so like I'm looking at, there's a website, schistosomiasis.org, that talks about this. They did a little study with IC patients. They report finding adult worms in semen and vaginal samples along with urine samples. Just not something. I mean, listen, the MAP Research Network, disciplinary approach to the study of pelvic pain. If this were real in the vast majority of patients, believe me, multiple studies would have already found it. The University of Maryland is the first study that did a massive biome research on trying to figure out any living beings in the urinary tract, bacterial, virus, et cetera, et cetera. That was 20 years ago. And of course, now we have the MAP Research Network, and what they're finding is virus, fungus and virus. If there were worms in our bladder, they would have found it. They have not found it. I don't have a problem with you having, if you think it's an issue and you want to have a test, I don't have any problem with it at all. Why not? But this is a very small study, 21 people. It's just not enough information to make any broad claims about this. All right. Remember that next generation urine testing finds DNA of everything, DNA and RNA of everything. And so fungus, virus, bacteria, and they would have found something like that, and they simply haven't. But again, I don't have a problem if you want to get tested. I don't. Okay. Pauline says, does lichen sclerosus affect flares, which just diagnosed it? Lichen sclerosus is a neurological condition that affects the vulva, where your skin basically turns super, super white. You don't see blood flowing through it, and it's considered a neurological condition. And so I don't think it's necessary. I mean, remember, the nerves are connected. So the nerves for the vulva, the nerves for the bladder, they all merge up at the spinal cord. And so the odds are, if one part of your pelvis is screaming, another part of your pelvis is probably going to start feeling irritated too through neural crosstalk. Betsa says, do you have recipes? Yes, guys, we have a website called the IC Diet Project, icdietproject.com. Please go on over there and check it out. It's filled with recipes for IC patients. Fern says, can you spell the anxiety course? I have it. Just go on over to our website, icnetwork.org, and go to our Living with IC video series, and it's all in the video on anxiety. Sarah says, have you heard of a correlation between kidney stones and developing IC? No. No, the only correlation that I can think of is that a kidney stone is very sharp and it is covered with bacteria. And so if you have kidney stones that are passing through, there's a chance that those kidney stones could irritate the bladder wall, cut the bladder wall, abrade the bladder wall, and potentially even introduce bacteria to the bladder wall. That's one reason why it's important and to not be afraid of a cystoscopy, because when you have a cystoscopy, one of the things that they can look for are big kidney stones that can't pass through that could be cutting your bladder. Kidney stones, bladder stones are very common. They're very common in other parts of the world, especially in countries where you do a lot of salty preserved meats. Lorraine said, is preleaf good for a burning bladder even though you have not eaten triggered foods? Preleaf's purpose, now let me just do this. So preleaf, for those of you who don't know, is the oldest supplement on the market that's used by IC patients. It's a simple calcium glycerophosphate tablet. What it does is reduce the acid in your urine. So if you're going to eat something that's strongly acidic, like grandma's lasagna, spaghetti, even alcohol, lemonade, something like that, you could take some preleaf before you eat it, and that could reduce some of the acid load of the food. So if you're eating acid, preleaf is absolutely viable, but preleaf is not a treatment. It is not a treatment for the bladder. So I guess, Lorraine, the question is, why is your bladder burning? Is it burning because you've eaten something you shouldn't eat, that's acidic? Then yeah, then definitely preleaf might be helpful in terms of reducing some of that acid load. But if your bladder is burning because you have infection, then preleaf would be completely irrelevant to that. But I want to just take a moment and thank DSC Healthcare Solutions for sponsoring this support group meeting. They have been a sponsor of almost all things IC for the last 25 years. Preleaf is a beloved product in the IC world that has helped thousands of patients eat a more balanced diet. Fern says, please tell me how to get the flare guide. To get our flare guide, just go on over to our website, icnetwork.org, and sign up for our newsletter. A pop-up box should come up. Just put your email address in. You send it, you'll get a thank you note with a link to download your flare management guide. Hello, Angelique from South Africa. There's very little help in South Africa for IC. How do we get products to South Africa? I have issues with my bladder wall. The protective layer is gone. I started using estrogen cream, and that seems to help. Not sure how much is safe to use. You need to talk to your doctor about the right dose. Also, you have pain at night when I lay down. Why? If you have burning that is positional, you're fine when you stand, but when you lay down, it hurts. That points us entirely to tight muscles that are compromising a nerve. That's IC subtype 4 pudendal neuralgia. So anytime your symptoms are positional in nature, you're fine when you stand, but as soon as you sit down, ow, it hurts. That points us to positional issues, which points us to muscles that are compromising a nerve in some way. How do you get products to South Africa? You should be able to order them from our website. I think we've got South Africa activated. If we don't, pop me an email, icnetwork@mac.com, and I will help you. We'll figure it out. Lauren says a DMSO installation is what destroyed the rest of my bladder. Would not recommend. Yeah, DMSOs absolutely out. The vast majority of doctors are not using DMSO at all. Hello, Debbie from Wisconsin. DMSO in a concentration of 50%, which is the FDA-approved concentration, has been found to cause irreversible bladder spasms in some cases. It should only be used in a cocktail where the approximate dosage is about 25%. Generally, it is combined with a triamcinolone, a sodium bicarb, maybe an antibiotic, but it's just not used very often anymore. Hi, David. Can gold and steel irritate the bladder? Betsa, I'm not sure. I mean, that's just going to be one of those things where you got to try it and see how you do. Eileen says, I believe that my onset of my flare was from strawberries. I haven't eaten them in a month. They never used to bother me. I'm also under stress, in which I have tried meditation, but the pain of my full bladder is stopping me. So, Eileen, here's the thing, is I had an absolutely terrible flare from strawberries. And I remember we were traveling in Arizona with my family, and I had a piece of strawberry pie. And I was in agony that night from strawberries. Strawberries are well known to be very, very acidic. So if you eat a lot of strawberries, that's challenging for us. You can get away with 1 or 2 strawberries, but eating a big bowl full of strawberries, really well known to be very, very irritating. Also, guys, listen, if you're not familiar with the Environmental Working Group, the EWG publishes a list every year called the Clean 15 and the Dirty Dozen. These are the foods that are either have the lowest level of pesticides, which is the Clean 15, or the Dirty Dozen, the highest level of pesticides and fungicides. Strawberries has been at the top of the list for the last couple of years. And so do not eat regular strawberries. Only get organic strawberries. And this is from the FDA's own data. This is the testing of the US government that has found this massive contamination of fungicides and pesticides in the meat of strawberries, in the meat of the fruit. You can't wash it off. It's in the meat of the fruit. So again, you can go to ewg.org, read the lists, search for it, Clean 15, Dirty Dozen. I think it's been an absolutely fabulous, fabulous resource. Becca says, is there something available to do at home with muscle therapy? Yeah, it would be a glass wand. Well, and books, obviously. But here, hold on. So most people with pelvic floor issues are going to be they're going to be using a glass wand like this. And the reason why this is the one that I use when I need to, when I'm starting to feel tight. It's this shape because it's much, much easier to access some of these more deep, funky muscles. And so you basically insert it and you will just rub along the length of the muscles, or they might have you rub side to side. But having a home wand is a must so that you can teach those muscles and correct those muscles when they start to get tight. And it's interesting because it works really fast. I mean, like I started feeling very, very tight earlier this week, and I thought, oh, I better figure out what's going on. And while I generally have pain on my left side, when I do my pelvic floor work, the most tender muscles are on the right side. But it only takes a couple of minutes for those muscles to release. At least for me, that's what I find. Susan said, would a chiropractor help with IC symptoms? No, chiropractor is not necessarily going to help the bladder if you've got IC subtype 1 or IC subtype 2. But if you have IC subtype 3 pelvic floor, and more importantly, you've got tight pelvic floor muscles because there's something wrong with a bony structure, like your tailbone or your hip or your knee, chiropractic might be relevant for that. I tell the story. I was a year ago in our magazine of a patient who, over a decade, didn't respond to bladder therapies at all. She attended one of these lectures. I said, "You're an anatomical mystery to be solved." She read about the subtypes. She thought she had pudendal neuralgia because her symptoms were very positional. So she went to the doctor. The doctor said, "Yeah, I think you do have pudendal neuralgia," which means you've got muscles so tight they're compromising a nerve. So the question then is, why are the muscles tight? And the answer goes right back to bony structures. And in her case, what all of her testing showed is that she had broken her tailbone and it had healed crooked. So it was straight and crooked instead of, your tailbone is supposed to be curved like that. Hers was bent and crooked, right? Crooked. And it took chiropractic to try to get her bones in the correct position. Chiropractic, I will tell you, scares me a little bit. I think some chiropractors can be very, very aggressive. I've had chiropractic myself, and the whole hitting the spine hard suddenly scares me. And I have one IC patient who's a very dear friend of mine who sustained a spinal injury late last year from a chiropractor drop table who was too aggressive. So I think it's very important that you work with a very seasoned chiropractor and you tell them to be very gentle and ask them before they work on you, have you had any issues? You know, I mean, I'm uncomfortable with chiropractic. Let me just say that. Hello, Jennifer from Utah. Has anybody here tried medical marijuana? Jennifer, we did the longest study. We did a 10-year study on medical marijuana with IC. I will tell you, many patients use it very, very successfully. It's a question of finding what works for you. I will tell you, in our study, it was always an edible. The edibles were more successful than smoking, because when you smoke, the byproducts of that combustion process do end up in your urine, which is why cigarette smoking is the #1 cause of bladder cancer. So we don't necessarily want those heat-induced byproducts. So doing an edible would be better. I think it's very important before you do any medical marijuana that you look at the testing results of the company to make sure that it too has not been contaminated with pesticides and fungicides. There was a very, very interesting case a couple years ago of a gentleman down in Los Angeles who had a very, very severe back injury, and he used medical marijuana for his back. And at one point in time, after his latest purchase at a medical marijuana dispensary, and he was buying what he thought was high brand organic medical marijuana, he got very sick from it. And he really thought the medical marijuana was hurting him badly. And so he paid to have it tested. And it came back filled with pesticides. Even though the company said it was organic, it was not. So he took those results to a TV station. And a TV station went in and did their own study. They went to a bunch of dispensaries. They bought a bunch of different brands, organic, non-organic. And almost all of them had really significant pesticide levels, including the brands labeled as organic. And so you can't just walk into a dispensary and just say what's really good for pain. What you're going to say is, you know, when you walk in, you're going to say, I'm here because I have pain. I'm looking for THC rather than CBD because it's the THC variation, which is the pain fighter. But you're going to say, I want to see testing results. I'm not buying anything without testing results. I want proof that this product is not contaminated. Even if it says organic, show me the testing results. And if they cannot give you testing results, or if they're not available on their website, I wouldn't touch it with a 10-foot pole. There is one company, Fairwinds Cannabis, in the state of Washington that was specifically mentioned a couple of years ago in a pelvic pain course taught at the American Urology Association, Fairwinds Cannabis. And specifically, they had a vaginal insert and a rectal insert that got pretty good reviews, enough that the speakers at the convention mentioned it. Okay, so remember too that you can get CBD from hemp, and hemp is legal everywhere. Hemp is legal everywhere. It's considered a food product. You can go to Target, Walmart. You can go to the IC Network store, and we have hemp cream. We even have, hold on, where is it? I mean, listen, guys. Oh, here, hold on. Let me grab this here. With so many people throwing off their pain meds, I mean, the enemy here is pain. The enemy here is pain. And if there is even a remote chance that hemp CBD might help reduce some of your pain, I think it's worth trying. So as an example, we have Hemp Max from Douglas Laboratories. This is legal in every single state. Okay, but I have something far more successful, proven by research, and that is PEA. So last year, it was exactly a year ago, actually 13 months ago, that the first PEA IC research study was presented at the American Urology Association conference. PEA stands for palmitoethanolamide. Palmitoethanolamide has been available in Europe for more than a decade. It has been studied with a wide variety of pain conditions, from fibromyalgia to sciatica to burning mouth syndrome. Lots and lots of research studies are finding that palmitoethanolamide has been remarkably successful at reducing pain, especially neuropathic pain. And I knew about this more than a decade ago. The problem was that it was too expensive. There were a couple of pharmacies in San Diego that were importing it for IC patients, but it was costing thousands of dollars, right? Well, times have changed. So now the Italian researchers IC researchers did a big study with PEA and IC, and the data was simply stunning. At 3 months, 87% of IC patients using palmitoethanolamide had a significant reduction in their pain. At 6 months, every single patient using it had a significant reduction in their pain, and 25% were pain-free. Now, we can't get the UMP formula from Europe and the United States, so Natural Approach Nutrition created Peora instead as a US version of that research formula. Slightly different, obviously, has to be. But we have been using this now. IC patients have been using this now for quite some time. It was developed about a year ago. And this is, to me, the most exciting product that we have because it has the potential of reducing your pain. We also have, as you know, Bladder Builder is the first bladder supplement that has chondroitin in it for the bladder wall that also has PEA in it. And we just sent out a month ago a year-long research study of patients who have been taking Bladder Builder. And what was the number one symptom it helped them with? Pain. We'll be publishing that data soon. So if you're struggling with pain, then it would be reasonable to try something like Peora or Bladder Builder if you also have a bladder wall issue. Of course, there's no way that anybody can tell you it's going to work for you. Obviously, I'm not a doctor. I'm not giving you medical advice. My job here is to give you options, to show you options. And that is a viable option now. And so it is there. Lauren says, my urologist did DMSO during a cysto in 2018. I didn't know until I woke up. I didn't have a choice. I was very angry. That really, so you must have had a hydrodistension with cystoscopy. Because a plain cystoscopy, you would be awake. You don't have to be asleep for a plain cystoscopy. So sounds like they did a hydrodistension with cystoscopy and then did a DMSO treatment afterwards. He should have told you. You should have had a discussion with him before that about possible therapies. That's a shame. Sherry, thank you. Thank you, Sherry. I really appreciate that. Sherry said I looked beautiful today. It's very, very sweet. I'm just very hot. I'm just sweating, which is why I keep moving my head around. Brittany says, I finally figured out that the pain I've been feeling at the end of my urine stream is a bladder spasm, right? Okay, it's gotten worse over the past month to the point that I've started med. I started Miratric Levsin. The Levsin works very well, but if I don't take it, I'm guaranteed to have a major painful spasm. My pain level is pretty minimal otherwise. I don't understand why this happens every time I pee. I really don't want to be on Levsin over the long term. So guys, Brittany brings up a really, really good point. Now, you have to understand that you've got two distinct types of muscles in your pelvis. You've got the striated muscle of your pelvic floor, the skeletal muscle of your pelvic floor, obviously for moving, but your bladder is composed of smooth muscle, different type of muscle. So if you're having a pelvic floor spasm, you've got to use a skeletal muscle relaxant like Flexeril or Baclofen or Valium. But if you're having a smooth muscle spasm, you have to do a smooth muscle relaxant, which is going to be like Detrol, Ditropan, Levsin. I've taken Levsin. I took Levsin. I used to have really, really bad bend over and screamer bowel spasms. Of course, we eventually figured out that was due to chocolate. And that happens when I eat chocolate or oatmeal. But Levsin is an example of a smooth muscle relaxant. Let's talk about a bladder spasm for a moment. Generally, a bladder spasm occurs as the last couple of drops of urine are coming out of your bladder. And so think about it. Your bladder is normally small, right? And then it expands as it gets full. And then as you start peeing, it gets small again. And then eventually what happens sometimes is that the walls of the bladder touch. And it's a moment that they touch that they kind of go, ee! They just don't, that's kind of one theory, is that it's the irritated bladder tissue touching each other, which is causing that spasm. But there could be other reasons why it could be spasming too. Generally, a medication like Detrol or Ditropan, I only had bladder spasms once. And I had them, it was 6 weeks into what I thought was a really, really bad flare. And I went to my urologist's office and ended up, I was crying. I mean, it was so bad. There's nothing worse than being afraid to pee because you know you're going to have a bend over spasm on the toilet as the last couple of drops are coming out, right? So I showed up at my urologist's office unannounced. I didn't call and make an appointment. I was just sobbing. And they took me right in because they'd never seen me sob because I was their support group leader. And I was describing this. And the nurse, Lori, pats me on the shoulder and she goes, Jill. I'm like, what? She goes, don't you know you're having a bladder spasm? I was like, no, I know I've never had this before. I don't like it. Make it stop. And they tested my urine. And what was a flare turned out actually to be a really bad bladder infection. I've only had 2 bladder infections in 30 years. So that was one of them. And so bladder spasms, I think, are the most common when the bladder is severely, severely provoked or infected. It'll be interesting, Brittany, to see if they calm down. I mean, you've got the medication that you need. Now they calm down. Now you got to buckle back down. Make sure you're following the diet. Make sure you're not doing anything that's irritating your bladder wall. And in the meantime, having your urine tested, maybe doing a next generation urine test to see if you might have a fungal infection in addition to potentially or in place of a bacterial infection. That's a possibility. Deb says, do any of these studies with Peoria Bladder Builder say anything about frequency? Well, the study was actually done in Europe with something called UMPEA, UMPEA, and we can look it up. Here, hold on. Let me just pull my my summer 2019 IC Optimist. Actually, it would be the fall. Well, hold on. Or the spring. Here it is. Here it is. Here it is. Here it is. In Italy, researchers did a study with 23 IC patients who had not responded well to traditional prescription meds for treating their IC. Each patient began taking 100 milligrams of ultramicronized PEA, also known as UMPI, a day. The patients who had an initial exam history and evaluation of bladder symptoms were followed up at 3 months and 6 months. By 6 months, 75% of the patients had a significant decrease in pain and 25% had no pain. They do not mention frequency in that study. Hey guys, let me just take a moment and start the Zoom meeting. So hold on a sec. All righty, we are just starting the Zoom meeting. You are using computer audio. I hope that's working. Okay, so the reason why we switch over to a Zoom meeting is so that you can ask your questions yourself. And so I'm going to put the invite into YouTube and Facebook. So for those of you who have questions and you would like to be able to ask it yourself, you can join in. Okay, now Facebook, I'm sorry that I might not be able to scroll back and see your questions. All right, so there's your invite, Facebook, for the Zoom meeting. So for anybody who wants to come in the Zoom meeting, we'll do the Zoom meeting, and then we may or may not come back to doing our regular meeting. So you guys have your invites. And let me know if you need the password, and we will go from there. Hey, tell you what, let's just go ahead and take a quick potty break. I gotta go. How about you? Everybody, go get your snack, go get your water, run to the bathroom. I'll see you on the other side in about 60 seconds. All right. Oh, it's too hot. It's too hot. All right. Hello, Catalina. Hi, Chris. So you guys, everybody, you're going to be muted in Zoom to start with. All right. So that we're not maybe 8 or 9 minutes. So you guys come on in when you do. So listen, I need some help. What I love about working with you guys is that I get to help me. And let me tell you what I need help with here. So IC Awareness Month is in September. And every year we have to have a slogan. We stand together. You are not alone. And we need a slogan for 2020. And this is a tricky year. This is a very, very tricky year. It's been a stressful year. It has been a tragic year, and I think we need to do something that unique way. And so I'm looking for ideas for a slogan. Anybody have anything? Because sometimes, you guys come up with the great ones. Hi, Annie. Hi, Gudu.
Hello?
Yeah, hi, Chris. Chris, just hold on a sec. We're not ready to do it yet, so I'm going to mute you, okay? All right. You hang tight. Guys, if for anybody who wants to come into Zoom and ask your question, I am posting your invite. Oh God, I almost canceled Facebook meeting. Yeah, crap. Didn't mean to do that. All right, here. Looks like not too many people want to come into Zoom. That's okay. I don't got a problem with that at all. All right. So what do you say? We stand together. We support each other. We inspire each other. Come on. Anybody got any ideas here? Help me, help me, help me. Betsy, you didn't see the invite? It just went in. I'm putting it again. You see, maybe it's a problem with the invite.
Do you think maybe some of them have not installed it yet, the Zoom?
Yeah, you're right. Yeah, you guys, you do have to download a little app here. That's okay. All right, now I've just messed myself up here. Hold on. Okay, now I got to do this real quick. All right, I'm adding Heather and Carol. Awesome. John says, not seeing the Zoom link on Facebook. Okay, like I'm just putting it in there again. You didn't see that, John? Like literally after your thing. Hold on. Okay, now I got to do that real quick. All right. Hello. Yeah, hold on. Anybody that's in Zoom, you're muted right now because we're just trying to get this set up. All right. Carol DeSanio says a possible slogan is "We can help each other." That's quite lovely. Okay, so for people who you cannot see the Zoom invite, could you email me? If you email me icnetwork@mac.com, I will email you back the invite, okay? Oh, and Annie says, how about just love everyone? Oh, I love that. I love that. Here, hold on. I got to write these down. Annie, that's really not bad. I see we can help each other. Or love everyone. I think that's wonderful. You know, I had a really good one a month ago. I think I was talking to you, Donna. Donna says the IC connection. Or slogan, let's keep talking. The IC connection. Okay, well, anyway, listen, would you please think about it? Let's just think about it. Let's go on over. So All right, so this is the way we're going to play this, my friends. This is the way we're going to be playing this. So we're simulcasting now on 3 different platforms. I got Facebook, I got YouTube, I got Zoom. We're now going to go over to Zoom. You guys are going to hear, for everybody on Facebook and YouTube, you're going to hear all of this. But what you're going to hear patients asking their own questions now and me asking them questions, okay? And then when we're done with Zoom, we will probably come back to Facebook and YouTube, but I'm not shutting everything down. You're going to hear everything. But if you want to be able to see stuff, like I'll be able to share stuff on my computer. And now I'm looking for email address. If you want an invite to Zoom, you can email me icnetwork@mac, that's short for macintoshcomputer.com. And I just do not understand why you guys aren't seeing the invite. Tammy says you are, oh, Tammy said, this isn't bad. You are never alone. You always have an IC family. Oh, that's something I need to hear. You always have your IC family. Sometimes we get lonely, and I was doing that yesterday, as a matter of fact, thinking, feeling a little on the alone side. Very hard. Life is hard. Deb says, let's keep talking. I like that one too. Okay. All right, guys. So I'm going to come on over now to Zoom. And let us see. Donna says it might be a combination of a few slogans to make up one. Yeah. I'm trying to unmute Catalina.
Hi.
Hi, Catalina. Yeah, we lost your video. There you are.
Yeah,
How are you doing today?
I am good. Thank you.
Awesome. That's what we like to hear. And how is your IC?
It's doing well since like a year ago.
Okay.
And my question is basically if there is any type of birth control recommended for IC people, because I don't want to destabilize my hormones. And so I don't know if there is anything like recommended or I should just not try them.
Well, I mean, ultimately, in the end, so number one, we can be very sensitive to chemicals. So spermicides can be a little tricky, right? Yeah. A non-latex condom obviously would be a first choice with something like KY jelly to make it more comfortable. Some patients do just fine with birth control pills, others don't. It's really just trial by error. What I can say is that IUDs seem to bother a few more people. And so the thought of having an IUD, it would be a little bit, I've just had more people over the years report that IUDs were a little bit more uncomfortable than something else. That's a great question. And you know what? Hold on. You know what I'm going to do? I'm going to assign this to Stacy as an article. Let me have Stacy research it. Let's see if we can do an article on it and survey a whole bunch of patients and see what people prefer. What a fantastic question, Catalina.
Thank you. Thank you very much.
You are very welcome. I appreciate this one. So hold on. Let me just put this here. I love it because you guys inspire us to do better work too.
You are amazing. Thank you.
Okay. Now, Chris, it shows that you're trying to come in twice. So I'm going to, okay, and there's Julianne. So let me add her. Chris, I'm not going to bring you in twice, but I'm coming to Chris now. Chris, can you hear me?
Yes, I can hear you. Sorry, I was just trying to like see if this device works with Zoom. That's all.
Okay.
Okay, sorry about that.
How are you doing today, dude? How is life treating you?
Well, lately I've been kicking myself over, like, about my dental health. About I should have, I shouldn't been so severe about following, Clark Howard's advice about using credit cards, being in it, about being able to pay them off in full every month. But it's just that it's may also been apparently misunderstanding about the APR and supplement.
Okay, so I didn't follow that last part. So guys, Chris is one of my oldest, dearest IC buddies. You know that, Chris. We actually have met. Chris, since you've already bring it up, I'm sure you won't mind if I say that he's been going through some dental problems, and yet your teeth look so pretty when you smile, Chris. So anyway, he had quite a few unexpected dental challenges, and that they hit the pocketbook pretty severely, right? Right. Okay. Well, okay. So guys, understand when you have interstitial cystitis, if they put you on things that cause, you are absolutely going to be at much more risk of dental issues. There's no doubt about that. Remember, the role of mucus in your mouth is protective. Just like your mucous membranes, they're meant to be wet. And that moisture adds a protection. And in your mouth, it protects you against bacteria and cavities and stuff like that, right? And so when you have dry mouth, you're going to be much more prone to having dental issues. So you got to really up your dental game. You got to really improve your health care, your dental care. The thing, and I just want to plant this seed. Let's see, how do I want to say this? Every one of my molars were hollowed out and silver fillings were put in there when I was a kid. It happened to my siblings too. We had a terrible dentist, absolutely terrible dentist. Tiny, tiny fillings filled with, they hollowed out our teeth. And I'm missing one there now. All the silver fillings are gone but one. But what happened is my teeth cracked. They were all cracked. So about 15 years ago, I had to have 7 root canals and 5 crowns. It cost me $25,000. And then my new dentist has been awesome. But one of the things he kept saying to me is, Jill, use a water pick. I'm like, no, only old people use water picks. My memory of a water pick was my grandmother's water pick, and it was disgusting. It's like, no, I'm not going to do it. He goes, Jill, I promise you, if you use a water pick, it's so much better than anything else you can do. And I was so sick of spending the money, and my savings account at that point in time was empty. It's like, all right, give me a water pick. I have not had a single cavity, and I've had perfect tests for 10 years now using a water pick. So guys, get a water pick. They're fabulous. Okay, so anyway, Chris, how is your bladder? How is your IC? Are you doing okay there?
Well, I still have to feel the urge to go on shishi way too often. It's been about the same for a while, more or less. And
okay.
It's often not my when I'm lying down. It's often it seems like at first if I'm feeling maybe something in my thighs or at least one of my thighs or something like that. I have to feel the urge to get up and pee and stuff.
Okay. Well, we've talked about this before. So Chris is an example of somebody who definitely has bladder wall sensitivity, bladder wall irritation. Sometimes family members get it and sometimes they don't. Sometimes family members bring home food that you shouldn't eat, but unfortunately you do have to eat it. So, dude, you know what to do. You know how to pick the right foods and all that sort of stuff. So, but anyway, hey, listen, Chris, I got to tell you, it's fantastic. Nobody would ever guess that you're having some So something's working for you, my friend. Something is working for you, okay?
Yeah, and it's just like if you were to see like this one canine too, like the palm, in particular, it's like a victim of like enamel erosion.
I know. Well, I got it too. My two front teeth are cracked myself. So, all right, Chris, it's good to talk to you. I'm gonna move on. All right, Julianne. Let's see, Julianne. Are you there, Julianne?
Yeah, I'm here.
Hello,
I'm here.
Hey, girl, how are you today?
I'm doing good. I'm struggling with bladder pains.
All right.
This week.
All right, tell me about it. What's going on?
I keep on having to get up 3 or 4 times a night to use the bathroom.
Okay.
My bladder's very irritated. The pain is through the roof. I just can't seem to catch a break.
Okay, tell me about the pain. What does it feel like?
It feels like if there's like gasoline every time I use the bathroom.
Okay, is the pain in your urethra or is it pain on your vulva? Is it inside of your body or outside of your body?
Inside.
Okay, is it low? Is it shallow or deep?
It's deep.
Okay. Does it get worse as your bladder fills with urine?
Yes.
Okay, and do you feel better after you empty your bladder?
It takes like 45 minutes to an hour before the pain goes away.
Ooh, really?
Mm-hmm.
So you don't feel an instant sense of relief when you pee?
No.
Is your urethra burning or is it mostly deep up the bladder?
My urethra also burns, yeah.
Okay, how old are you?
I'm going to be 28 in 2 weeks.
Okay, and when did this start for you?
It started when I was about 10 or 11.
Okay. Have you had a pelvic floor examination?
Yes, I have.
And what did they find?
They found that my bladder is very like cracked. My bladder lining is very irritated all the time. And I also got diagnosed with endometriosis.
Ooh. Okay, but what about your muscles? Did you go to have you had a proper pelvic floor muscle examination?
No.
You need to have one. So let's go back to when you were a kid. So you say this started when you're 10 or 11 years old. Do you associate any event with the onset of your symptoms? I mean, you were young, you might not remember, but does your mom say, hey, it happened after this or happened after that, or it happened on a trip or whatever? Was there any event?
No, I remember like eating certain foods and then calling my mom at work in tears, telling her that I was in pain and my doctors couldn't figure out what was wrong with me.
And it was bladder pain that you were having.
Mm-hmm.
Isn't that interesting? Okay. Do you have super sensitive skin?
No.
Do you have a wicked sense of smell? Can you smell things that other people cannot smell? And do smells drive you crazy?
No.
Okay. So when we think about the bladder and we think about children specifically, there are kind of a couple of scenarios. Scenario number one is there any chance that there was a physical trauma? So as an example, were you riding a bicycle or a tricycle? Well, at 10 years old, you're riding a bicycle, right? Were you riding a bicycle and could you have jammed your crotch on the bar of the bicycle or the tricycle? Was there any sort of physical trigger? And you know, the thing is it could have happened when your mom didn't see you. But what we do know is we had one research study that was published in the Journal of the American Medical Association, which showed, and this was specifically about boys and men, that if a young boy jammed his crotch on the bar of his bicycle even once badly as a kid, that he would be more inclined to have frequency urgency in his 30s and 40s from that initial trauma, right? And so there is a possibility that there could have been some sort of trauma And that is really why it's so important that you have a proper pelvic floor examination to make sure that there's not some sort of legacy injury, right? Because there could be. Could you, I mean, every kid falls on their tailbone. And so that fall could have created a foundation for what you're dealing with today, possibly. And I think you should, is your mom still with us?
Yes.
Why don't you ask her back, have her describe what you were doing when you were 9 or 10 years old. Were you really athletic? Were you running around a lot? Were you bouncing off of walls? Were you falling a lot? Anything at all like that? That would be interesting. Question number 2 is inheritance. Does your mother have any issues with her bladder? No. Okay. Do you have any siblings who have any bowel or bladder issues?
No, I'm the only one in the family. So
okay.
It's hard to get my family to understand what I'm going through sometimes.
Okay. The third thing that we want to look at is the possibility of chronic infection. Now, let me ask you this. Have any bladder therapies ever helped? I mean, what therapies have you done for your bladder so far?
Well, I was on Almaron for like 2 or 3 years.
Okay.
And then I got off of it because my vision started to change and get blurry.
Okay, but did the Almaron help your bladder at all?
It didn't feel like it did because I was still in pain while taking it, and it was still bad while I was taking the Almaron.
Okay, and again, and I apologize if I ask this question. You are food sensitive, right?
Yeah.
Well, I mean, have you had a hydrodissension? Did they actually look in your bladder and see if you had Hunter's lesion?
Yes, they did.
And what did they find when they looked in your bladder?
They didn't find any like lesions, but they did find the scar tissue and stuff for the endometriosis.
Okay. And they found scar tissue inside of your bladder?
Mm-hmm.
So the endometriosis perforated your bladder wall and came inside of your bladder.
Correct.
Ooh, Betty. How long ago was that?
That was in 2014.
And have you had any, has your endometriosis gotten better, gotten worse?
It's gotten worse.
See, the thing is you wouldn't, now my period started when I was in 4th grade. So I was an early puberty girl. I wonder if you were an early puberty girl too. Well, okay, so you are an anatomical mystery to be solved. And clearly what we know is what you've done at this point in time has not given you the relief you not only need, but you deserve. And at this point in time, we don't know if you sustained a physical injury. Do you have scoliosis?
No.
Do you have one leg longer than the other?
Hmm?
Do you have one leg longer than the other?
Yes.
Okay. Are you doing anything about that? Do you wear an insert on one foot to keep your hips level?
I have an insert in my left shoe.
Okay. Okay. So that's important. Okay. So if I were you, I think that we don't know. Obviously, we don't know. You don't know. I don't know. We're guessing at this point in time. And frankly, you deserve much more than a guess. There are 3 things that I would do if I were you. The first thing I would do is I would go to your OBGYN and have a pelvic floor assessment. And let's figure out if your muscles are involved because we don't know. And I'm going to tell you that I don't have any percentages because we don't have a good working group with children who have IC, but muscle injury and traumatic injury is common. When I think about when my symptoms started in 7th grade, okay, and I couldn't sit through class, and they thought I had infection, and I had urethral dilations because my urethra was really, really tight. there were two fundamental things that also happened. In my very first x-ray, they found that I had scoliosis, and I had already broken my tailbone, and I had the tip of my tailbone was floating around in there. Because I remember sticking my finger back there and moving my tailbone around, the tip of my tailbone around. There was a little chunk of it that was floating. And I think in hindsight, when I look at those early onset symptoms, I really think that they were driven by muscle issues. And so we have to rule that out. You have to rule that out. So concept number one is get your muscles checked. And with your endo, the reality is your muscles are probably really tight anyway, because pain makes you tighten muscles in the guarding reflex. I think it would be really important to get an update on your endo. You need to tell her that it's worse. And maybe do a sonogram and something like that. See if it's already attached to your bladder once. I would be very curious to see if it's on your bladder again. Did they resect your bladder to pull that endometriosis out?
Yeah, they did.
Ooh. And they did that in 2014.
Mm-hmm.
Are you worse now than you were before that happened?
Yeah.
Were you noticeably worse even, like 6 months after the surgery? There was no relief at all from resecting your bladder from that?
No.
Okay. Well, I certainly, if I were in your shoes, I think I would want them to relook at the endo just to make sure that it's not lurking. Have you had any examination in your bladder after that? Has anybody done a cysto just to look at your bladder wall in the last 5 years?
No, not at all.
Again, I don't like guessing. I like facts. And if I'm in pain, I want somebody to look at it. I think it would be curious to look at your bladder, just and just see if there's a legacy of, is there a stitch that was left in there? Something? I mean, I don't know. It would be fascinating to look at. And then I think the third thing that would be interesting would be a next generation urine test, just to see if there's any chance that you could have had a bacterial infection or a viral infection or a fungal infection. We do know the MAP Research Network has continued to find fungal infections in some IC patients. And so it's just a piece of data. It's a piece of information that I think is useful, just to rule stuff in or rule stuff out. So you are the epitome of an anatomical mystery to be solved. And I'm sorry that it's as complex. Your case is complex. And the fact that you had endo perforate your bladder and enter your bladder is very, very tricky. Did they put you on Lupron or anything?
They had put me on Lupron, and then they took me off of it because they saw that the medication wasn't helping, and I was starting to fall into a really bad depression.
Okay. Are you a member of the Endometriosis Association?
No.
Okay, you should join them. They are fabulous. Their website, I think, is endoassn.org. One of the things that they discovered early on about endometriosis, I mean, this is a really fascinating story because the IC nonprofit and the endo nonprofit got started at roughly the same time in the mid to late 1980s. They had a very, very early breakthrough where they found a very small research study that showed that certain chemicals triggered dioxin in monkeys. Specifically, triggered endometriosis in this research study involving chimpanzees, I think. And so what it was the chemical industry trying to prove that dioxin was safe. So dioxins are considered the most toxic chemical ever made by man. They happen when you burn plastic. And unfortunately, you burn the plastic, it goes up into the air, it circulates, cows eat the grass, the dioxin ends up in their milk, it ends up in their meat, and eventually in our ice cream, yada, 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 ends up in our bodies. And so this was the plastic industry, chemical industry, trying to prove that dioxin was not harmful. And so what they did is they did something called the dose ranging study where they gave small doses and they slowly increase them over time in this population of monkeys. And it's just, it's why I don't support any animal research and why I gave up on my pharmacology degree, because I love animals. And I think what they did is unconscionable. What happened is one of these monkeys died, and they did a necropsy or an autopsy. And that little monkey was with endometriosis. And,
Wow.
and so same thing, another one died, same thing. And so they finally published this chemical industry journal, which showed that they believe that dioxin caused endometriosis. Well, this nonprofit found the study and found that they were going to just either destroy all the monkeys or sell them off for another research study. And so they petitioned the National Institutes of Health to do exploratories on them. And what they found is every single animal in the study had endometriosis, and that it was a dose ranging effect. The more the dioxin, the more the endo. And it is, so endometriosis is considered the epitome of a man-made disease. And they have now linked many different chemicals. About once a year, a new chemical is linked to the development of endometriosis, and a new warning is set out. And it was the Endometriosis Association who did that work. And in fact, you know what? I tell you what, I did a big interview with them, and I bought 2 books from them for my interview a couple years ago. If you email me your mailing address, I will send you one of those books. Or both of them, because I just cleaned out my shelves and I don't need it anymore, but I would be more than happy to send those books to you, okay?
Okay.
One of the things they say is it's really, really important. You got to get rid of all the chemicals in your home. No Febreze, no scented candles, no oven cleaner, nothing like that. And I have a section of our website devoted to that, but you can find some of that information on their website too. But email me your address and I will send out the I'm pretty sure I can find them. I will send one or both of those to you, okay?
Okay.
Okay, hon. Well, it was nice to talk to you. I hope you'll give me a phone call afterwards, send me an email afterwards, and let me know what they find with your pelvic floor and with your endo, okay?
Okay.
Okay, hon.
Thank you so much.
Big hugs to you. Big hugs to you.
Thank you.
Okay. Okay. Carol. Now, you guys, I'm always out of order here, and please don't take it personally if I don't get to you right away. Let me go, because Stacy, you came in a little bit later, so let me go with Carol first. I'm trying to unmute you, Carol. Carol, are you there?
Yes.
All right. How are you doing today? Now, can you turn your camera on so I can see you?
You know what? Stand, because start video.
Start video.
Here I am. My pink hair.
There. Oh, I love it. I love it. You go. You know what? Isn't it great? You guys remember that when I was a kid, if you were over 40, you had short gray hair with curls, right?
Mm.
You know, and women had super, super short hair. Hey man, not anymore. We're gonna be rocking young hair until we're 90 years old, as far as I'm concerned. And I just say, you enjoy the color. She's got, for those of you watching on Facebook or YouTube, she's got beautiful bright pink hair, and I love it. Yes, Ruth, we are on Zoom also. And Brittany on Facebook says, my neighbors burn their plastic trash once a week. Brittany, honestly, I would call your local fire department and see if that's legal. I do not believe that that's legal. And that's actually quite dangerous and would be exposing all of you to the byproducts of that. That's why we also don't burn Christmas paper anymore, colored Christmas paper like we used to, you know, because of the chemicals. All right, Carol, how are you doing today?
I feel a little, pressure pain down there.
Okay.
Yesterday, I went to a cookout, and I actually put a diaper on because, I didn't know what the situation was going to be. Was it going to be porta potties? Was I going to be able to go into a person's house and use the restroom? And I actually went to another private party before, and I wore a diaper, and it actually worked out for me because they had one porta potty, and I hate porta potties, but as you know, sometimes we don't have a choice. And I would just go into my car and turn on the air conditioner, recharge my phone, and sit there and pee in my diaper. And it was great. I don't know. It was just because I didn't have that anxiety of worrying about having to use a porta potty. But yesterday, the guy that owned the house, he let me use his house, the bathroom in his house.
Okay.
Which was good. So I didn't need to use the diaper.
Okay. But how's your bladder? Did you eat something that triggered you today?
I haven't eaten anything yet today.
Okay. But yesterday, did you eat something yesterday at your cookouts that could have triggered you?
You know, by the time we got there, the food was kind of old and like had been cooked a lot earlier, and I'm afraid of food poisoning.
Okay.
So we ended up just going up. Friendly's was right next door, and got a hot dog and French fries.
Okay.
I did have a couple of those truly seltzer flavored waters. They have acid in them, I'm pretty sure. The hard liquor, you know.
Maybe some do, some don't. You just have to kind of look at the ingredients. So your IC is it better or worse today than it was a month ago?
It seems a little worse today. You
Okay.
know, you have days that are good and days that are bad, but you know, it's a constant, like always thinking about, I got to go to the bathroom when I'm sleeping. I'm thinking I really should get up and go to the bathroom, but I'm too lazy. Plus I take a lot of meds to go to sleep.
Okay.
And I was thinking maybe I should just wear a diaper to bed and pee in my diaper. And
Well, no. How long have you been dealing with IC symptoms? How long has this been going on for you?
Over 25 years.
Over 25 years. And how old are you now?
61.
Okay, so we're about the same age. I'm going to be 60 next Sunday. Oh my God.
Ooh, happy birthday.
It's crazy. I don't know how that happened. I feel 25. It's so weird.
I still do. I know, me too.
It's so weird. So your symptoms started in your 40s when you were, right? Or in your 30s? Is that 35, around 35?
I think so. I mean, I really don't know exactly when it started. I mean, possibly. My son is 32.
Okay.
So maybe after I had a baby, I don't know, because I got, when I was a child, I went to bed till I was 11.
Okay.
Was never taken to a urologist for any of that.
But you didn't have any bladder problems when you were a teenager in your 20s. They all started when you were in your 30s, correct?
Yeah. I mean, I had my son when I was like 27. I'm thinking it kind of happened after I had a baby.
Okay.
Like,
okay. So have you had a pelvic floor? Okay. Have you had a pelvic floor examination?
I did.
And what did they find?
She said that I would definitely benefit from having the pelvic floor treatments.
Okay.
You know, manually, I went like once or twice a week, but then the pandemic happened and that had to stop. And I did buy one of those wands, but I have yet to use it.
Yeah, you got to learn how to use it. I mean, it's weird. It's weird at first. I mean, honestly, I didn't get comfortable with it for 2 years until finally I got that book, Breaking Through Chronic Pelvic Pain. That's a book which helped me visualize my pelvis more so I could do it effectively.
Mm-hmm.
So this is the book, my friends. This is the book. Yeah. Y'all should have this book, read this book, because it will teach you more about your pelvis than any other book out there, in my opinion. So
yeah, she told me I should go on YouTube to learn how to use the wand correctly. There's a lot of videos.
Yeah, but see, the thing is you've got to be able to visualize the field that you're working with, and this will help you understand where the muscles are, where the bones are, where the ligaments are, and the areas that you're kind of working. And so I think that this book is stunningly good. It's just stunningly good. And it's free on Kindle Unlimited. So come on, if it's free and you belong to Kindle Unlimited, just get it anyway. So When I don't know. I don't know. Yeah, you can check. So it's obviously, I'm not a doctor. I don't give medical advice in any way, shape, or form. It's really a question of just trying to understand your anatomy. So we know your pelvic floor muscles are messed up. We just don't know when they got messed up. We know you did physical therapy, and you're just kind of getting started with that. And I would encourage you to keep doing that, because we cannot undeny the influence of the muscles over the bladder, or deny the influence of the muscles over the bladder, and vice versa. We could get your bladder calmed down, but if the muscles are still tight, your bladder is always going to be messed up, and vice versa. We can get the muscles, calm down, but if the bladder's still messed up because somebody has a terrible diet or they've got estrogen atrophy, we're going to have an issue there. And so, yeah. So
I always feel like, the muscles, don't they get tight because I'm constantly feeling like I have to hold in.
Yeah. If you're, I mean, literally this could go back to you bedwetting, and the fact, and if you were spanked badly because you wet the bed, you could. Okay. Well, some kids are, and they will then subconsciously tighten their muscles. Their muscles end up in this really nasty tension pattern for the rest of their life. And that's really sad when that happens. That's really, really sad when that happens. So
I never got spanked, but my poor mother, who was very sickly, she had to, wash sheets every day and hang them out on the line to dry. And then I found out years later that my brother also wet the bed. But my mother died when I was 11, and I had to move in with relatives, and I had to sleep in a bed with my cousin. And for some reason, I was able to stop wetting the bed. I don't know if it was the trauma of the whole thing, and I didn't want to have to be embarrassed about having that problem. But
well, I mean, so it's just, every family deals with it. I wet the bed too. It's no big. I'm not worried about that. The question is, why are you having symptoms today? And you're either having symptoms today because your bladder wall is messed up, your pelvic floor is messed up, or there's something else inside your pelvis that is impacting your bladder. And so ultimately, in the end, it is a diagnosis of exclusion. We got to start ruling stuff out. And if you're not happy where you are, if you're getting worse rather than better, what the American Urology Association says is take a step back and revisit the diagnosis. Let's make sure we haven't missed something. Let's make sure we haven't missed something like a fibroid tumor, like endometriosis, like a Tarlov cyst, like a mechanical injury, like having a bad foot or a bad hip that could be leading to long-term chronic stuff. So I would encourage you to come on over to our website and go into the diagnosis area and look at the list of confusable conditions, and just go through that and go, could that be me? Could that be me? Could that be me? There might be something else that has been missed.
Yeah, I go to a urine gynecologist who's actually, his name is one of the doctors that's recommended from your website in Massachusetts.
Okay.
But he's like a type of doctor that just puts Band-Aids on things, like wants to give you medication, like you put me on Myrbetriq, but I can only get samples because my copay is like $200 a month.
Yeah.
And then he does lidocaine installations. Then he wants me to take Almiron. I said, didn't you hear the side effects about Almiron? And he says no. And I'm like, what is wrong with these doctors that they don't, if they specialize in that, they don't know about it? I mean,
well, the Almiron is very new. The FDA warning only came out 2 weeks ago, and you remember, you are an educator. Listen, medical care today is different than it was before. We no longer can walk into a doctor's office and expect a full comprehensive workup. They don't have the time. They're not allowed to spend the time with the patient like they used to. So you and I, we all have to be much more diligent in how we are working and preparing for those appointments. And we have to walk in prepared to lead the appointment. And what do I always say? Yeah, Stacy's nodding. Right. You can't walk in and say you've got IC. That is a total mistake. You got to walk in and talk very specifically about your symptoms and then say, okay, doc, I'm trying to understand, why do I have this pain in this location? Can you help me understand the anatomy there? Can you please help me understand this anatomy? What could be driving this symptom? And the devil is in the details here, because ultimately in the end, it's often a little weird, obscure symptom that you don't even think to tell the doctor about that solves the mystery of your pain. Is there a vibration? Do you feel something fluttering when you move in a certain position? Does it do anything weird? Is it better? What makes it better? What makes it worse? Those are, so you have to do your due diligence ahead of time and really strategize how you're going to spend that appointment. You don't walk in and say, I need a treatment for this. Your first objective is to get them to study your body more effectively.
Yeah, because he's just the type of like, well, maybe you should come in, 2 to 3 times a week and get the lidocaine.
Well, that's reasonable. There's nothing unreasonable about that. The protocol for a rescue installation is 3 times a week for 2 weeks. Why? Because we're trying to calm the nerve down. They're just hitting the nerve over and over and over again with an anesthetic. And when you because getting excited nerves to calm down is hard. So if you chemically shut it down over and over and over again, the theory behind that is that you're going to just slowly reduce the activity of that nerve and slowly silence that nerve. So the original protocol for a rescue was 3 times a week for 2 weeks, then once a week for a month after that. And so there's nothing wrong with that. That is a reasonable protocol for what they're trying to do. The challenge here is we just really don't understand what the trigger is, what's causing it all. And that's, I think, where you need to spend a little bit more time in terms of trying to figure out what's causing it all. And so
when they say like it's IC, you think it's like that's like a general term.
IC doesn't mean anything.
Right.
It doesn't, especially interstitial cystitis, because it implies there's a problem with the interstitial, like there's interstitial pneumonia or something like that. We already know the term is the wrong term. And that for some people, the correct term is urologic chronic pelvic pain syndrome. That's a correct term. But who's going to say that? Nobody's going to say that, right? Ralph is going right. And in Europe, if the only people diagnosed with IC are people with Hunner's lesions, everybody else is diagnosed with bladder pain syndrome. So I don't really care what it's called right now. The point is that you're having symptoms. What could be triggering those symptoms? And you've got to pay attention to your muscles. You got to pay attention to your skin health and estrogen atrophy, because you and I are of that age. And we've got to look at the bladder wall and see if there's anything funky going on with the bladder wall, like endometriosis or a bladder stone or estrogen atrophy or chronic fungal infection or viral infection. So don't give up. Now it's time to ask questions. Right?
What would the doctor do to find out all of those things?
Well, they would potentially order a next generation test to look at chronic fungus, look for chronic fungal infections. They would maybe do a cystoscopy to see if there's anything structurally wrong with your bladder that they can see. They would do a pelvic floor examination to test your muscles. They might want to do an X-ray, a CAT scan, an MRI. We had one patient. Again, the devil's in the details here. One patient who, again, bladder therapies didn't work. They did not work for her. And she went from doctor to doctor to doctor to doctor. None of them helped. And then finally, she improved the way she was talking about it. And she said, my pain is by my urethra. It's by my urethra. And finally, a nurse practitioner went, you know what? Let's do an MRI. They did an MRI. You know what she had? She had a fistula. So your urethra is like the size of your finger, right? Mm-hmm. She had a fistula, literally the exact same size. It was a little tiny tube connected to a little pocket of tissue that was filled with urine that would not drain. And she was cured surgically when they removed the fistula. She was cured. She'd been diagnosed with IC for a decade or longer. So at some point in time, it's okay to say, hey, could we just look and see if there's anything weird going on? Maybe do an x-ray or maybe do whatever. I mean, what I do know is that the bladder therapies are not particularly helpful for me. And they're not giving me a result. So I'm curious, is there anything else we could have missed that could be triggering some of these symptoms? I mean, that's why you are an anatomical mystery to be solved. Okay?
I know. Yes, I will have to like talk to him and see if he can, you know, look into things further. I probably will order the book and be more educated. So when I go into the
hey, listen, Carol, I'm telling you right now, you read this book, you will know more about a lot of this than your doctor will, in terms of how the muscles influence the bladder and how the bladder influences the muscles and vulvodynia and bowel issues and perineal issues. One of the things that's so interesting, I remember when my vulvodynia was bad, my pain was always on my perineum. My perineum was like fire. And so the perineum is that little bunch of tissue between your vagina and your rectum, right? That area used to scream for me. And he explained why. The perineum, let's see if I can show this to you. I'm sorry. So here's your vagina, here's your rectum. There's a little button right here that's called the perineal body. It's an attachment point for 4 muscles. For 4 muscles attached right there. That's why the perineum hurts so much. So again, and for me at the time, it felt like somebody rubbed sandpaper over my vulva. And no, in hindsight, it really had everything to do with muscles and muscle tension. So get that pelvic floor assessment and let's go from there. I've got to move on, Carol, but it was wonderful talking with you. Let's keep in touch, okay?
Okay.
All right, hon. Okay. Kim, are you here? We'll go from Kim to Stacy and then Ralph, because Ralph, you came in last, I'm sorry to say. Kim?
Yes.
Hello, hon. Can you turn your camera on? If you don't want to, that's okay. I can't hear you, hon. Your voice is very, very faint.
Yes, I'm here.
Okay. 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 Can you just, let's just do a sound check. Can you just go 1, 2, 3, 4, 5?
1, 2, 3, 4, 5.
Okay, that's a little bit better. I'll just need you to speak up, or if you're on your phone, try to put the phone near your mouth so I can hear you more clearly. How are you today, hon?
Oh, I'm good.
All right, excellent. Your IC is pretty good?
Well, not really.
Okay. Oh, look at that. You're like the patient who goes to the doctor and the doctor goes, "How are you?" And you go, "Fine." And it's like, no, not really. All right. What's going on? What's going on?
Well, I'm moving to another room.
Okay.
I don't have competition with the TV.
Oh, that's better. That's better. Now I can hear.
This is probably a lot better.
Much, much better. Okay. So what's going on?
Well, we had dinner last night, and I'm pretty sure I'm flaring from the spices on the chicken, but
okay,
that's beyond that. But I actually have another problem I'm dealing with, which is anemia.
Okay.
So right now the doctor says to, build the iron levels back up.
Okay.
But everything I'm trying supplement-wise, I'm flaring from all the supplements.
Well, you mean all the iron supplement? You're flaring from the iron supplements that they're recommending for you.
Yes.
Okay. Then did we talk about this like 2 weeks ago?
I did send in a question, but either I missed it.
Okay. Okay. So, Iron is, I've been dealing with anemia in our family now for 15 years. My mother is severely anemic, so she has IC, she has vulvodynia. What's interesting, although they're very, very controlled now, what's interesting is that she tolerates the iron pills just fine, which we've been doing rather than the infusions during COVID, but we're going to go back to the infusions. Were you the one where you were concerned about the stearate in it?
Yes.
Okay.
Yeah. Sorry, I missed that one.
Yeah. Well, I mean, ultimately, in the end, it's about finding something that works for you. And I'm sure they've already talked to you about diet, and the best source of iron is going to be from red meat. And then the lesser sources of iron are going to be from things like spinach, things like that. If the supplements aren't working for you, then I'm sure the doctor's saying we can do infusions, because the infusions would not have the steroids that you're having the problem with. And the infusions are a piece of cake. I mean, I can't tell you how many hours I've spent at the infusion center with my mom. Have you tried an infusion yet?
No, I just didn't want to go that route.
Well, you might have to, hon. You might have to. If you're this sensitive to some of the other ingredients, they're so much easier, because you basically have an infusion every 6 weeks or every 2 months. It takes, you just bring your Kindle, bring a book. All they do is set up an IV. They give you a little tiny bit of fluids. They throw the iron in there. The iron is done in 20 minutes. And then you sit there for 30 minutes and just make sure everything's okay. We haven't had any issues with it at all. I think that the challenge with an infusion is that the day after you have an infusion, you might feel a little slow and a little uncomfortable, because that's when all your muscles are absorbing that iron, right? But the best way to restore iron levels is going to be with an iron infusion, or, God forbid, a transfusion. I wouldn't be, I'm not afraid of it at all, because I've seen it, and the infusion centers are fabulous. The nurses are fabulous. It's very short. The hardest part about being there is that your heart breaks because you've got chemotherapy patients sitting next to you, right? And that's the hardest part, is you just want to help everybody who's there. I don't know what else to tell you, hon. I mean, your diet, your diet sensitivities are real. You're having a real problem with oral iron. What has your doctor said?
As far as the iron goes?
Right, about the iron pill, that you're reacting to it.
Well, they don't know.
Okay.
So it was all just on me to experiment with any type of iron until I find one that works.
Right.
And I'm about to try a third different one, but we all know how painful that can be.
Yeah, absolutely. Well, I mean, you're experimenting. So why not experiment and try one infusion? See if, again, it's one of your options. And anemia running amok is not a good situation, because your blood is losing the ability to move oxygen throughout your body. And so you just get more tired and weaker and weaker. And so, follow your doctor's suggestions and do everything you can to get iron from as many natural sources as you can, right? But if your levels drop to a certain point, he's probably going to say, let's try an infusion. And, I will just say, being the daughter of a woman having the infusions and helping her every single appointment, pretty much, if it were me, I've seen it. It wouldn't be something that I would be afraid of, but everybody's different. Okay.
Yeah. And I guess one concern with that is the iron in itself, even being infused. Is that going to be painful?
Iron infusions are not pain. Hon, you've got iron in your body all the time.
Right.
You know, and
It's not enough. At this point.
yeah, just not enough. I doubt it. My mother has never ever complained of any pain with the infusion in any way. It just she doesn't like getting the IV set up. You know, sometimes
Well, sure.
sometimes
Yeah.
getting the IV set up is a little painful. But the medication itself, I mean, talk to your doctor and understand too. Listen, every infusion center is staffed with really compassionate, wonderful nurses. And if you have any girl, they have worked with patients all day. And if anybody knows any tricks to the trade, any experience, it's going to be that infusion nurse, that the people working in the infusion center. And so you can count on them to be there to comfort you and to help you understand, you know, what's going on and what you might be feeling, et cetera, et cetera. Hey, I can see
There
you.
I am. I had to figure that one out.
Yeah.
Okay.
Yeah. Okay. Good luck, hon.
Yeah. Well, thank you.
You are very, very welcome. And always remember, you are absolutely not alone in your struggles, especially with the anemia. It looks like it's running in our family. So I can tell from my sister and me that it's going to be interesting to see how we're going to be doing in a few years too. So peace, hon. Big giant. Okay. Is that a heart?
Yeah, thank you.
You know what I mean? You know what I mean? All right. I'm going to move on and let's go to Stacy, who's been sitting there so patiently. Hey,
Hi, how are you, Jill?
you know what? Aside from being hot, I am pretty good. How are you doing today?
I'm not doing too bad, but I am in a flare, and I think it's from me starting a protein shake. I needed to supplement and get more protein, and the fruits that I use are fake, but I think it's the protein. I am like lactose intolerant, so I went with a whey protein isolate. And that's supposed to be somewhat safe, you know, but I don't know. There's a more icy friendly.
Egg whites. Can you do the pasteurized egg whites instead?
I don't like eggs.
But hon, you can't tell. I mean, it's just
I can't tell.
No. It's powdered egg whites, and it's protein powder. It's just a really clean, crisp protein powder. There's a brand name called Just Whites that a lot of bakers use, and just put a tablespoon of that in, and all it does is it just makes it a little bit frothy. Is that the right word? Might be just a tiny bit frothy. But it's really good, hon. Really, really good. Hey, Marla over here on Facebook says, can you flare from swimming pools and hot tubs? The answer is yes, you can. All right, Stacy. So how is your IC doing? I mean,
other than that,
other than the flare from the shake,
I'm learning to manage it. You know, I just deal with things as they come. You know?
What did you put in the shake? What was in the shake?
Just it's just isopure protein, a scoop of that, some bananas, some blueberries, you know, whatever fruit I have in my freezer. You know.
Okay.
Some lactate milk sometimes. Yeah.
Well,
sometimes chai tea.
Oh no. Don't do any chai tea. No. Okay. That will absolutely trigger a flare. The chai tea is brutal. It's like super strong coffee. Even though it doesn't taste like coffee, the acid level and the caffeine level of chai tea is brutal. I love chai tea. I love the taste of chai tea. If you love the taste of the chai tea, just get yourself some cinnamon, get yourself some fennel, whatever. But don't use a normal chai tea mix. Did you do that yesterday?
No, I'm not. It's not the tea. Maybe I'm saying the name wrong. CHAI.
Yeah.
Teas.
Yeah, don't do that.
Those?
No.
Okay, so that's probably what's doing it, not the protein powder.
Yeah. Oh, yeah. 100%. 100%. I bet it's the chai tea.
Okay.
All right,
Thank
hon.
you.
You are very, very welcome. Any other questions?
No, that's all.
All righty. I'm going to go ahead and mute you. All right. Ralph, Mr. Ralph, Let me try to unmute you. There you go. Ralph, how are you today?
At the moment, okay.
Okay, I need,
Can't hear me?
no, I need you to get closer to your microphone.
Better? Is that better?
A little bit better, yeah. All right, what's going on with you? How are you today?
My biggest issue, first of all, what exactly is a flare?
A flare, okay.
I hear it tossed around all the time. I just don't know what that means.
A flare is a temporary exacerbation of your symptoms. Hi, Stephanie.
So,
Yeah.
so on a regular, consistent basis, I'm lucky to get an hour and a half, 2 hours sleeping without having to get up every night.
Okay. Okay. So Ralph, hold on a sec, Ralph. So your voice is very muffled. Can you, do you have a microphone you can put on?
Give me a minute. Or maybe give it. Go ahead and talk to something else while he does.
Oh, no. That's okay. That's okay. We're good.
Is this book still valid?
That is an old book.
Okay. Trash.
That's very old and outdated. It was the hot book back in the 90s, but not so much anymore.
Yeah, it's hot in the 90s too.
Okay, while you're doing that, let me just go back and look at Militia says, thank you for helping people. It is my honor to be here. Michelle says, I've been doing installations. I had to get a lidocaine because I'm allergic. I had to get, I think you said off of lidocaine because you're allergic. I was feeling improvement. My last installation was done by a registered nurse and I don't know how, but after that, I haven't been the same. I'm in this flare that won't go away. New symptoms are occurring. And now my doctor is saying she doesn't know how to help me. I'm so angry and depressed. All that improvement out the window. So Michelle, so you were doing the installations. You had to stop the lidocaine because you were allergic to them. But at your last installation, you were done by a nurse, but somehow you weren't the same. So, hon, that's where you want to get your medical record for sure. And let's see what they did. Sometimes nurses and or medical assistants might not make the formula correctly. Is there any chance that you can get your medical record and see what they actually put in your bladder that time? You never know. Okay, I'm going to go try. Ralph, let's do a test with Ralph. Ralph, definitely better. I just might need to have you hold it next to your mouth. Hold the mic part next. Nope, no, you're still muffled there too.
My regular camera died on me about 2 weeks ago, and I'm having trouble buying a new one.
Okay. Okay. Well, if you can just speak up a bit, let me. So your question was, what's a flare? A flare is a temporary exacerbation of your symptoms. It might last a few hours, a few days, a few weeks, or a few months, depending upon the type of flare you're having. Some flares can happen because you've injured your bladder wall. Other flares can happen because you've injured your pelvic floor. Flares can often happen during periods of high stress. Sometimes flare happens with a chemical exposure. Sometimes flares can be a mystery and we don't know why they happen. They just happen.
Okay. All right. Stress, yes.
Yeah.
Yeah, stress. Is that any better?
No, you're just muffled. It's like you're down a long tunnel. Do you have on your computer in your settings, are you using, have you make sure that the input device is your mic rather than your computer itself? Check your application settings there.
I just checked that. I'll check again.
Because it's not changing at all, even if you move it, which means you're probably using your computer mic rather than things. Hello, Stephanie. Carol, we're gonna stop the Zoom after Ralph, and we're just gonna go back to a regular format.
How's that?
Oh, much better.
This is funny. I took it off the camera and put it on the computer. Just the exact opposite of what you think you have to do.
Okay.
You got it right.
I did. I did.
I do this for a living, and that isn't so.
Okay. So, hold on a sec. Okay, guys, seriously, if you're going to the bathroom and you walk back into the room, don't be pulling your pants up at the same time.
The camera off.
Okay, there we go. That camera is now off. Okay, so Ralph, tell me more. How are you doing today?
I'm sorry. I'm not laughing at Carol. I'm laughing at you.
We're laughing at, hey man, life is too short. If anybody can define humor in restroom things, it's going to be us. Okay, so how are your symptoms?
Okay, I have Hunter's lesions.
Okay.
Okay. Severe case, I understand.
Okay, say
severe. That's how it was worded to my urologist. He's done the distillation. That's the word.
A hydrodistension.
Yes, he's done that.
Okay.
And that was god awful.
Right. Okay. And when did they do that?
It's been about a year. Unfortunately, my urologist has retired.
Okay.
And the company that's the urology company in the area is taking over every urologist in the area. And the way we do the billing is archaic.
Okay.
And I can't afford it, because what happens is they pre-charge what they think the insurance company is going to pay them. Yes.
Wow. Is that even legal?
So, apparently it is, because not only that, I understand even orthopedics are starting to do that also here. I'm out here in Myrtle Beach. I'm not in Carolina.
So when they did your hydrodistension, did they do any treatment for your lesions?
I wouldn't know.
Would they would they have cauterized them, lasered them?
No.
And
No.
That is so frustrating to me. Here they've made a diagnosis. Normally lesions are treated at the time of diagnosis. That when you are in the OR asleep and they are examining that lesion, they can treat the lesion at that time. So, and it's always a tremendous lost opportunity. You're not the, hey man, so what that means is that your doctor...
No, I'm trying to think back. They did do it, other than single biopsy. I'm trying to remember.
Okay.
I'm 70, so I'm at that age, right? I have CRS,
I get it. I get it. I get it. So again, for those of you on Facebook or YouTube, we're also on Zoom. So this allows patients to ask their own questions. And so our last speaker on Zoom before we go back to our regular format is Ralph. Ralph has Hunter's lesions. The lesions, he doesn't remember if they were treated. Are you better today than you were a year ago, or are you the same, or are you worse?
Yes and no, and yes. Does that make sense? No. I don't have the cramps here like I used to get.
Okay.
Where it would be like somebody was doing a knife into my gut.
Okay, that's good.
Those.
Okay.
I do get the burning sensation.
Where? Where's the burning sensation?
At the tip.
Okay, right. Which is just absolutely common. Okay.
Okay. I've since in the last month started wearing Depends.
Okay.
You know.
Oh, you got to do what you got to do. You know what?
I know it was you're right, and that has made a difference, because what I've discovered is that drives me out from not getting that constant burning from the urine.
Right.
Being
Okay, so do you have pain as your bladder fills with urine, or is your pain more in your urethra?
Pain.
So the fuller you get,
I get 2 to 4 ounces. On a really great day, I might get 6. On a super day, I might get 8 ounces. So
wow. So your capacity is really low.
Really low, right.
Did-
So I'm like you said, my biggest issue is I'm tired all the time.
Yeah.
You know, and on top of that, I got cardiac, and on top of that, diabetic, on top of that, and multiple.
So, how many lesions did you have? Did he tell you?
No, I just assumed the whole wall was.
No. Have you ever seen a picture of a lesion? Do you know what it looks like?
No.
Oh,
No.
you know what? Okay, so hold on a sec. I'm going to share my screen. I'm going to show you a lesion. So hold on a sec. This is why we like Zoom, because I can share my screen. So give me 1 sec and let me just set it up here. So hold on a sec.
I'm really getting tough prepared to talk. I was really going to listen, trying to get more information. So,
Okay. All right. So I'm gonna share my screen with you, Ralph. With anybody in Zoom will be able to see this. All right. All right. Can you see IC Network on the website on the screen now?
I'm good. I'm with you.
All right. So this is our area on Hunner's lesion therapy, and we have a video from the American Urology Association, which shows what a Hunner's lesion looks like, a Hunner's lesion or a Hunner's ulcer. So basically what they're doing at this point in time is they're slowly starting to stretch the bladder. And that center of the lesion, so you've got a center of a lesion here, and then you've got another lesion up here. You'll notice that it's starting to bleed.
Right.
See that? And they call it a waterfall effect. It can bleed. It can. There you go. See that?
Uh-huh. So they tell me I have water. They always tell me I have water in there.
Yeah.
Microscopic.
So that's different from, and I've got these pictures here. Hold on. Okay, I'm going to stop sharing the screen. All right, now you're back to me, right?
Yeah.
All right, so these are 16 different lesions.
Okay, I see them.
And you notice that they have what's called a stellate appearance. They've got a center red area, and then they have arms that tend to extend from the center red area. See that?
Okay.
That's a really good one right there. So normally they're going to either cauterize these, fulgurate these, or inject them with a steroid. What we know about lesions is when you biopsy the center, it's filled with inflammation. Now this is very different from this.
Yes.
Now this picture is really more a picture of an injured bladder wall, like chemical injury, something like that. These are little petechial hemorrhages or petechiae. So
Not the ulcers. Not the lesions.
these are not ulcers. This is more like
Okay.
if you fell and skinned your knee, you'd have a lot of little tiny wounds on it. That's kind of what this is. And so this is more the epitome of kind of injury, or perhaps chronic infection, chronic fungal infection, chronic bacterial infection, something like that. So lesions are their own unique entity. And so one of the mysteries is what causes lesions. And there's two kind of going theories. Theory number one is that it is a chronic viral infection, because we have researchers from Europe who have continued and consistently are finding viruses in the urine of patients with Hunner's lesions. And these are not sexually transmitted. This is the big virus is called the polyoma BK virus, which we all have. It's normally a part of the human biome. It just gets turned on in patients who are immune compromised. So if you were having a kidney transplant and they were giving you the rejection drugs, that creates an environment for these viruses to flourish and turn on. So we know that the polyoma BK virus can infect the bladder wall. And now we have our first research study from the American IC researchers who have also confirmed the presence of polyoma BK and polyoma JC in the urine of some patients. And so theory number one is that it could be a viral infection. You had a question?
Is there any research that would show that unrecovered alcoholic, that being alcoholic would be part of that? I've been sober for over 30 years, but is that part of that possibly? Because
I don't know. I don't think so. I mean,
I'm wondering if there's any difference between that and say soda or coffee. Alcohol is.
Well, they're all damaging to the tissue.
Okay.
They're all, whether it's alcohol or salt or acid, the bladder wall, like any other part of the body, can be hurt. And generally it's going to be hurt through some sort of chemical exposure. So if you've gone through chemotherapy, we know chemo is well known to cause IC-like symptoms from the caustic effect. If you as a kid drank Mountain Dew for 20 years, that constant daily acid wash would irritate right. I mean, who didn't?
Right.
Who didn't?
Right.
We didn't know and then God forbid it be diet, which adds a whole nother level of acid to it. Yeah, right. And so, so concept number one is, could you have sustained a chemical injury from your diet, from not drinking a good, not having a good diet? And the answer is absolutely. But the bladder is remarkably good at healing if we create an environment to support healing. So if you're still drinking acid, even 1 cup of coffee every 2 weeks is going to basically stop healing from happening.
Really?
Yeah. Yeah. The bladder is the slowest healing organ in the body. It is composed of the largest single cells in the human body. So imagine, and I got this from a lecture that I attended with Dr. Anthony Schaefer at at a National Institutes of Health IC meeting. We were talking specifically about the healing process. So the bladder wall is composed of the largest single cells in the human body. So imagine an extra large pizza. And underneath that pizza is a little tiny green pea, one green pea. That's the stem cell. So when the pizza is damaged, when the urothelial cell is damaged, this little tiny stem cell has to grow and change shape to fit into the spot where the cell was damaged. Okay? While that stem cell is doing its thing to replace the cell that is now gone, it is exquisitely vulnerable to acid. And what they said in that class I took, I think it was in Washington, D.C., as a matter of fact, is that 1 cup of coffee would destroy that next generation of stem cells. That while that stem cell is trying to grow and replace, it is exquisitely vulnerable to chemical injury. And I remember that because I remember that I was sitting with the other international patient representatives, and we were like, well, yeah, we all know that people who drink 1 cup of coffee a day are always going to be in the worst shape. Every patient organization in the world agrees that 1 cup of coffee a day takes a devastating toll on people with bladder injuries, because your bladder can't repair itself if you wash it with acid every day. And there's no therapy that can defeat that acid. The only fix for that, to create an environment that will support healing, is to lose the acid for at least 3 months and to give those tissues an opportunity to repair themselves. I know it's hard. And so I love coffee. I didn't drink coffee. I'm going to tell you right now, I probably didn't drink coffee for 15 years.
I didn't drink till I got sober.
Yeah, I know. There you go. Okay, so what can you, I mean, to give your bladder the best opportunity at healing, which you really need to do if you've got Hunner's lesions, chamomile herbal tea, peppermint herbal tea are smooth muscle relaxants. They will calm bladder spasms. That is proven in research. If you have to, actually, they will calm bowel spasms. If you ever have to have a colonoscopy, one of the best things you can do is drink peppermint tea or chamomile tea before it. They have proven in research.
5-year plan.
Oh,
5-year plan.
I am due this next year. It's like, oh, I don't want to do it, but I will. Okay. So chamomile herbal tea, peppermint herbal tea, rooibos tea. See how you do with those. I have a coffee challenge. And basically the coffee challenge is, if you're in a flare, don't do anything, just water. Because what would you put on a wound? Water and milk. So do water and milk. If you're starting to feel better, the first thing you do is the chamomile and the peppermint herbal tea. If you're okay with that, you then go to rooibos tea, which is a brown grain tea, which I bet you'd be able to tolerate without any problems. That's what I have, rooibos. If you do okay with that, then you go to the herbal coffees. And this is an example of an herbal coffee. It's called Dandy Blend.
Well, that's just dandy.
I know, yeah. And so this is made with roasted barley and rye and chicory root and dandelion root and sugar beet. Okay, and it comes in. We did a taste test. It's actually instant. You pour it into hot water, put your sugar in it, and your cream in it. It's pretty good. It's pretty good. So this is low acid. This should not bother your bladder as much. See, there's no 100% caffeine free, no acidity, no bitterness. So Dandy Blend would be very interesting to try. And if you do okay with that, then you can go with the real coffees, but they have to be low acid coffees. And it would be,
I didn't mean to mess up your vocabulary.
no. Bella Rosa has the lowest level of chlorogenic acid, which is the irritating acid in coffee in the industry. So Bella Rosa is, in my opinion, the best low acid coffee. Or Simpatico, which is also a low acid coffee, or Tyler's. Right.
Are any of those available with K-cups?
Yeah, they have K-cups, but get the decaf. Do not get the regular. Come on, you got open wounds in your bladder. The last thing you need to do is do caffeinated and have that caffeine hammer the nerves in your bladder wall. You should be doing decaf.
I didn't think it made a difference either way, caffeine or uncaffeinated.
Oh yeah, no. There's two different things you got to look for. You got to look at acid irritation and you got to look at caffeine, because caffeine stimulates nerves and will make you pee more. So even though it wakes you up and gives you energy in the morning, it is neurostimulatory. Caffeine turns your nervous system on, and it will trigger more frequency urgency, and that could.
I'm sorry, I just thought it was the acidity. That's what I thought.
No, it's both. It's both. Yeah, it's
okay,
both.
Okay.
So you could be an entirely new man in 3 months. I mean, just give it a try. Look, you come on over to our website and at least try the rooibos tea and the Dandy Blend or Caffrey Roma or Pero. There are lots of herbal coffees that are around, and they're kind of an acquired taste. They're a little bit slightly different, but tons of patients use them and they love them.
Coffee was an acquired taste.
Well, that's true too. All right, dude, Ralph, it was great talking with you. I'm going to shut down the Zoom meeting. Wonderful talking with everybody. It's even wonderful to see your faces. All right, so Zoom meeting is over. All right, I'm going to come back here to Facebook and YouTube. Hold on, all right, now hold on. There you go. Got to move that. Brenda says she would love to discuss her IC saga for the last 2.5 years. Well, Brenda, I would love to hear your IC saga. we're kind of, if you want to, so you guys just know that the IC Network, we do answer the phone. I do answer the phone. I work with patients almost every day, except usually Mondays. Usually take Monday off because I do these support group meetings and I kind of need to clear my head just a little bit and actually have a few hours to myself. But let's see, Brenda says, 2018, Hunter's lesions, bladder shrinking, had DMSO instills, which made my pain worse. I stick with the IC diet pretty well. Girl, if you have Hunter's lesions, DMSO would be pointless. You would be doing Hunter's lesion specific therapy, which would be cauterization, fulguration, steroid injection, hyperbaric oxygen therapy, or Lyris, which is the only treatment in history that has healed Hunter's lesions after just 2 weeks of therapy. So what have they done for your lesions, hun? Lesion-specific therapy. Michelle on Facebook says, you had to get off the lidocaine because you're allergic. It was feeling improvement. My last, okay. Marlene says, was that book You Don't Have to Live with IC? No, we don't recommend that book. That's an old book. This is the book we recommend, Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss, or The Interstitial Cystitis Solution by Nicole Kozian. He held up the IC Survival Guide, which was published like in 96 or so. Okay, Brenda says that they did cauterize her lesions. All right. Awesome. So how are you doing now, Brenda? Michelle says, how can I flesh out what they did? It's been 2 weeks. Girl, it's already fleshed out. It was fleshed out within hours. The question is could you perchance have picked up an infection when they did it? That's possible. You know, whenever you're catheterized, that does introduce bacteria into your bladder. If you anytime you ever get substantially worse after a procedure, we always want to make sure you didn't pick up an accidental infection. That's possible. Militia says, I spent thousands on distensions and Elmeron, and was the only thing that healed me was radical dietary changes after a long, painful journey. I am so happy for you, Militia. If you would like to write up your story and send it to me, my email address is icnetwork@mac.com, icnetwork@mac.com. I love success stories. I love sharing success stories. I'd love for you to write that up so I can share it with other people, especially what were your dietary changes. You know, we now know, for an example, Melissa, that some patients have fungal infections. And so by removing sugar from the diet and removing carbs from the diet, they get remarkably better. And now we know why, because they actually had fungal infections in their urine. Michelle says, is it possible to get back into remission? Absolutely. Absolutely. You get hurt, it heals. You get hurt, it heals. You get hurt, it heals. Brenda says, my bladder holds less than 200 mLs. I have not had an infection. Okay. Lyme disease absolutely associated with some bladder wall symptoms. They have found the Lyme bacteria in the bladders of patients and causing Lyme-linked bladder symptoms. Ashley says, I'm so new to all this and working on my elimination diet. Awesome, Ashley, awesome. But the most important thing for you to do, Ashley, is to watch our video on the 5 subtypes of IC, because not everybody is diet sensitive. There's a big group of patients whose symptoms are being driven by muscle problems and nerve problems rather than bladder wall problems. Nance says, can you take preleaf so that you can get away with drinking coffee? Well, Nance, if you had an open wound on your hand, an open bleeding wound on your hand, would you pour coffee and preleaf on that wound? The answer is no. No, you wouldn't. I think it's important. You have to base it on how you're feeling, like use the coffee test we use. But I think that if you're actively symptomatic, if your bladder is screaming at you, that's when you have to take a step back and go, all right, my bladder needs some comfort and healing right now. Let's lose the coffee, hot water, do hot water with sugar, hot milk, vanilla milkshake, something like that would be much more gentle on your bladder wall than coffee. Brenda, you know what? Why don't you give me a phone call this week? If you go to our website, the phone number, or just go to our Facebook page, phone number is right at the top of the page. I'd love to talk to you and hear more about what happened with you, hon. I would definitely like to hear your IC saga. No doubt about that. Lisa says, I have it all. Burning, chronic itching, pelvic pain, fibro, always in pain 24 hours. I'm at a loss. All right, so this is what, Lisa, this is when we break it into simple, manageable pieces here. Okay, so that's the hard part here, is that when you're feeling your worst, you've got to work hard to try to help the doctors narrow it down. So this is what we want to know. We want to know, number one, what is the health of your bladder wall? What is the health of your pelvic floor? And what is the health of your skin? What is the health of your skin? The quality and health of your skin is absolutely going to be influencing how your bladder is. If you're dry down there, if you have a dry, itchy vulva and you dry, itchy vagina, then you might be in estrogen atrophy. You might have vaginal atrophy, what we call the genitourinary syndrome of menopause. And so that losing that estrogen will cause all of your mucous membranes to get drier. Thus, they're going to burn more and they're going to be more itchy. So what is the health of your bladder wall? What is the health of your pelvic floor muscles? And what is the health of your skin? So come on over to our website and at least read the section on the 5 subtypes of IC to try to get you started there a little bit more. Brenda on YouTube says she has terrific spasms. I've had pelvic floor therapy. I've had 9 hyperbaric treatments. And yes, I have your phone call. Awesome. So are you having bladder wall spasms or pelvic floor spasms? And also, have you done a next generation urine test? I think that would be very telling. Lisa says she has estrogen cream. All right. Are you using it? There's a difference. A lot of people, the doctors give them estrogen cream and they don't use it. I was one of them. I didn't use it for a year until I started having issues. I didn't realize the importance of estrogen cream. Okay, Lisa said pelvic floor is very bad therapy. It didn't help me. Now, Lisa, my friend, Lisa, are you saying that when you went to pelvic floor therapy, it hurt? Did it hurt you? Why are you saying pelvic floor physical therapy was bad for you? Did it hurt? Because let me tell you, if they touched a muscle and triggered pain, that is actually huge. That is actually a really, really good sign. It's what I call a hallelujah moment. Because if they can touch a muscle and trigger your pain, they found it. They found the muscle. Now we have to figure out what they were touching that's hurting so bad, so we can try to figure out what the problem is with that muscle. Deborah says, thank you, Jill. You're amazing. I don't know what I would have done without you. Oh, okay. So Lisa, it hurt. So did it hurt in one location? But see, but Lisa, this is important. This is encouraging. The fact that pelvic floor physical therapy hurt is very, very encouraging because number one, it says, all right, your problem is probably with your muscles. Now we have to figure out why it hurt. You, my dear girl, you have got to get this book and read this book. This is a pelvic floor anatomy class. It is the best written book ever. It's super easy to read. And as you read it, I want you to be thinking about what were they doing and what were they touching that was hurting? This is so important because you can't listen. I call it the chicken versus the egg dilemma. The chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. They're both involved. They have to both be involved because they're so interconnected. But one is normally driving the other. And this is why when patients call, we like to go back to when their symptoms began to see if there was some sort of triggering event. So if your IC and your bladder symptoms began after chemotherapy, we know the chemicals of the chemo are irritating and damaging your bladder wall, and you're in pain from the chemo. And of course, your muscles are going to get tight to protect you from that pain, right? So here you've got a spasming bladder because chemo's hurting it. Your muscles get tight to protect you from it, right? That's called the guarding reflex. Our therapeutic priority for the chemo patient is to calm and soothe the bladder. We know, so what are we going to do? We're going to dilute the urine, maybe modify your diet, do things that will calm the bladder wall, like a rescue instill or azo or something like that. And that as we calm the bladder and we reduce the pain, the muscles should relax. That's the smaller group. The other group, you've got a perfectly healthy bladder, but you sustain a muscle injury. Bam! Your muscles get tight and they're squeezing a healthy bladder. And of course, you have no clue that you have a muscle injury. Your first symptom is frequency, urgency, pressure, pain. And of course, with those symptoms, you're going, it's got to be an infection. You call the doctor, you go, doc, I think I got a really bad infection. Can I have some antibiotics? The doctor goes, sure. They prescribe them over the phone. Or the doctor goes, yeah, let's do a culture first. Your culture comes back negative. But your doctor goes, well, maybe you missed something. They give you the antibiotics anyway. Okay, the antibiotics don't work. You go back to the doctor. The doctor goes, you must have overactive bladder. They give you the overactive bladder meds. They don't work. You go back to the doctor. They say you've got IC. They put you on the IC meds, Elmeron, DMSO. They don't work. And the reality is for this patient, no bladder therapy is going to fix the problem because the problem is tight muscles that are restricting blood flow. Our therapeutic priority for this group of patients is to restore blood flow. How do we do that? With physical therapy. So think about your muscles could be locked down like this, right? So what does a physical therapist do? A physical therapist will use their finger and they will go along the length of the muscle to try to get that muscle to release. And if your muscles have been locked down, they're going to hurt when you push on them. But ultimately, in the end, there's no oral treatment that's going to fix a tight muscle other than using a little bit of muscle relaxant. But what we've got to do is restore muscle health, muscle functionality. How do we do that? Is with physical therapy to try to get the muscles in the right length, the right consistency. You know, when you pop okay, my muscles are so bad right now. Hello, I'm older. If you pop a bicep, my little tall tree bicep right now, it becomes hard. The muscles have contracted. You know, muscles are normally like this. When they contract, the fibers slide like this. And the fibers get, so when you pop a muscle, you've done this, and this obviously made it bigger and gives you that muscle definition. And when the muscle relaxes, the fibers relax again, and your muscles are now long and lean again. But if you have an injury and you have a trigger point, the muscles get locked here. And when they get locked here, it's really hard for anything in your pelvis to be normal because you're not getting good blood supply, because you've got blood supply going through muscles, you got nerves going through muscles. That's what sciatica is. If you got shooting pain in your leg, that's a tight pelvic floor muscles compressing that nerve. So April says, I'd like to know, I had a horrible accident years ago. My nerves are in horrible condition. I feel my IC is because of nerve damage and diet. I've been wondering if the accident was the main fault. Probably, hun. What was your injury in the accident? Lisa says, do you constantly need therapy? No, but you're going to need therapy for the short term. You might need therapy for 3 months, 6 months. It depends on what they find, what the injury is. April says, would lemon tomato are triggers? Can it still be subtype 3? Yes, it can be, because your bladder, it won't be healthy if you have tight muscles. Because your bladder's not getting nutrition, it's not getting blood flow, it's not getting everything it needs to be healthy, right? That's the viscerosomatic reflex and the somatovisceral reflex. And again, get this book. It's free on Kindle Unlimited. No excuses to be had. This is your homework. Read this book. Start at the beginning and learn the anatomy so that when you're talking with your physical therapist, you will understand what she's touching, what she's working on, how they're connected. This is mind-blowing, this book. The chapter on the feet is stunning. It's stunning. He introduces the concept of a mechanical injury. Listen, and Lisa, listen, this could be you. So let me explain this mechanical injury thing. So Dr. Weiss, the guy who wrote this book, was a urologist dedicated to IC. And he was very, very frustrated that patients weren't responding to bladder therapies. And so he took a step back and he's like, all right, let's think about all the other things that influence the bladder. And he ended up becoming a muscle specialist, myofascial specialist, muscles and nerves, right? And so in his clinic in San Francisco, he was able to diagnose muscle dysfunction and nerve dysfunction in many IC patients. And the thing that stunned him was that he could get somebody out of his office with normal muscles. The muscles were fine. He could fix trigger points. He could relax muscles. He could do all of that, right? But what struck him as being so curious is, why would they come back a month later in a new flare with trigger points and muscle problems in exactly the same spot? It's like, but we fixed this a month ago. Why is it tight here again? And the answer comes down to bony structures. And this is something that I've said even before I read the book. I've said this, is if you have long-term chronic pelvic pain, you have to take a step back, and chronic muscle tension. You got to take a step back and let's look at the anatomy as a whole, specifically bony structures, because what are muscles attached to but bones? So, do you have a hip problem? Do you have one hip higher than the other? Do you have a knee problem where you're not walking normally? And in this book, what he eventually figured out in his clinic were that 90% of the patients who kept coming back with flare, muscle tension, it came right back to their feet and how they were walking. Because if you're walking, think about it this way. If you've got one leg longer than the other, so you've got one foot lower than the other, the arch on the low foot is going to flatten and the arch on the higher foot is going to arch to keep your hips level, right? But that's not normal to walk that way. That's not normal. If you have shin splints, if you've got plantar fasciitis, if you've got Morton's toe, Morton's neuroma, that is going to affect how you walk. And the muscles in the pelvis are directly impacted by how you walk. And if you have a weird arch, if you overpronate, anything like that, that is all going to be reflected up into the pelvic floor. And this book does a fabulous job in explaining how these muscles, let's see, let me get to the foot chapter here real quick. He shows you exactly what happens to the pelvic floor with certain foot conditions. And so, and he calls treating pelvic pain unraveling layers. You're unraveling layers of pain, layers of discomfort. And the last layer is, for many patients, the foot. And so he talks, for example, about Morton's neuroma, or Morton's toe. So do you have a second toe that's longer than your first toe? So look at the joint here. The joint in the ball of the foot is higher than the joint of the big toe. That's a problem. And the reason, and that will absolutely affect how you walk. Because in a normal foot, your big toe carries 66% of your weight load, and your second toe carries the rest of the weight load when you walk. But if you got Morton's toe, where your second toe is longer than your first toe, your second toe is carrying the bulk of weight, and then the rest of the toes are also carrying weight. It leaves your big toe out. And so what happens is you get hammer toes. I have a hammer toe. So a hammer toe, I don't know if you can see that. Can you see how this toe is bent a little bit downward? That's because that toe is trying to help me walk. It's trying to grip the surface, but that toe should not be involved. And that is because I have Morton's toe. My second toe is longer than my big toe. And there's a fix for that. So what he found in his clinic is that 90% of the patients that were coming back with chronic pelvic floor tension and pain had foot issues, if not Morton's toe. And it's fixable for $2. And I just went by the picture. Where is it? What you do is you put a little piece of moleskin, a little round piece of moleskin under the knuckle of the big toe so that the big toe hits the ground first. And that will correct how you're walking, and that will work with your pelvic floor. Hold on, where is it? Come on, I just saw it. You see this picture? All you do is you put a little round circle underneath the big knuckle, and that will ensure that the big toe will hit the ground first, which will definitely improve how you're walking. So Lisa on Facebook, you need to get this book so that you can understand why touching your muscles hurts so much. You might have scoliosis, you might have a hip issue, you might have an SI issue. There could, or it might just be, maybe you've got, maybe there's an issue with your feet. Maybe you're pigeon-toed or duck-footed where your toes are, or pigeon-toed is where your toes are inside, duck-footed is when your toes are on the outside. It's amazing. It's amazing. This book is changing lives. It's curing people. People with muscle issues can be cured. Lisa Kim says you have sciatica. So Lisa, if you have sciatica, that means you have you have a tight piriformis muscle, and you have to work on that. And yeah, it's going to hurt at first. Your muscles have been tight for a long time. Listen, after I had my hysterectomy, I had pelvic floor spasms for 10 months. It felt like there was a hand up my vagina grabbing on tissue and trying to pull it out of my body. It was awful. And when I finally went to my OBGYN again, he gasped and he goes, "Oh my God, you're having involuntary levator spasms." I'm like, "I know, it's bad. Help me." And he goes, "Well, there's a fix for this. It's pelvic floor physical therapy." And I'm like, "Sign me up." He goes, "I need to warn you, it's going to hurt. You're a post-surge patient. It's going to hurt." And he says, "A lot of women drop out too soon." And I'm like, "I'm not a lot of women. I'm not a lot of women. Sign me up. I want to try it." And I did not find the physical therapy itself to be that painful. I mean, I was like going, a good physical therapist watches your face to see how you're reacting. So I would like go, like that. But I wasn't crying. I didn't start crying until I went and sat in my car, because the act of going from standing to sitting for me is what hit my incision and my scar tissue and my adhesions. And so he was right. Listen, the first 2 appointments were challenging. The appointment itself wasn't that bad. It was afterwards for me that was hard. Driving home was hard. I came home, I bawled the first time. I came home crying, and I collapsed into my recliner with a heating pad, but I went back. And it was the third visit that that sitting in the car didn't hurt for me. And now, it took like 5 appointments total to stop my spasms. And every now and then they get tweaked again because I sit too long. Like right now, my left butt cheek is starting to vibrate from me sitting here for so long. Michelle says, I have chronic urgency. I notice my body doesn't feel discomfort as much as when I'm in cold water and doing electrical treatment. So you got hit as a pedestrian by an SUV. My right hip was messed up. I've been working on it and the muscle grew, but the nervous system problem remained. Yeah, so the challenge with nerve injuries is that injured nerves become easier to turn on. It changes their action potential of the nerve. It just becomes easier to turn on. So you end up with sensitivity in the area, nerve sensitivity in the area. Think about all those old timers who would be rubbing their knees and going, oh, a storm must be coming in. Because when you suffer an injury, not only are bones broken and muscles broken, but nerves are broken. And so an example of kind of a broken, traumatized nerve is a nerve that's just easier to turn on. That's that sensitivity. So it doesn't surprise me that you've got issues after being hit by a car, hun. I've worked with several patients who have been hit by cars. And so therapeutically, you would be doing things that would be calming nerves down. Like, for example, it'd be really interesting to try the Piora, because palmitoethanolamide has been found to be particularly helpful for people with neuropathic pain. So something like Piora would be a fascinating experiment to try. And the cool thing is it's got research behind it showing that it can help reduce the symptoms of IC with no reported side effects. Very, very few side effects with PEA. I went through as many studies as I could, and virtually every study said no side effects, except for one that said a little bit of gut distress. But this is something that when my nerves start getting crazy, when I start having a lot of pinpricking sensation on my skin, this is my go-to to calm those nerves down. So Piora, palmitoethanolamide, would be interesting. It would be an interesting experiment. But there are other things. They might have you on Neuron. They might have you be doing acupuncture, post-tibial nerve stimulation, stuff like that too. Anything to calm nerves down. Robin says, no more doctors touching me ever. Robin, I know you replied here earlier. You grew up from a plastic plant 1 mile down the road. You worked in a oh, girl. Yeah, you've had a lot of chemical exposure, my dear. And now you had a fall on your sacrum, and you have an entrapment and L4, L5. Oh, girl. Oh, my God. Yeah, Robin, really, seriously, get the book. I really think it will help you understand context, anatomical context. I think that's really, really important here. And don't be afraid of doctors. You don't need to be afraid of doctors. You need to be in command and control of that appointment. You pay them, they don't pay you. You're not going to go in and say, I don't care what you do anything. That's a mistake. You're going to go in and say, I'm trying to understand my anatomy and what my treatment options. Tammy says, what professional would help you with your feet? A podiatrist with a P. No, not a chiropractor, a podiatrist. Annie says she signed up for the curable application to see if it will help the mind-body connection and help reduce ramped up nervous system. Awesome. Well, so Michelle says she doesn't believe that my hip is tense. I've done pelvic floor treatment, but it doesn't do much because I don't believe I have that issue because I don't have what others describe, just crazy urgency, and I can't void as much. You are in denial about the connection. They're both involved. They cannot not both be involved. The bladder is hardwired to the muscles. The tight pelvic floor muscles happen because of bladder pain, just like injured muscles can cause the bladder wall to break down. So it's not one or the other. They're both involved. They're both involved. And they both are going to need therapy to some degree, especially after a complex injury like the one you had. Lisa says, everything hurts. Just getting to the pelvic floor is agony, even in exam. Right. So that tells us your pelvic floor is very, very complexly involved. So again, start with the book, learn the anatomy first so that you can understand what they're touching. It's going to be so much better for you when you understand what they're doing and the logic behind it. And they can start slow. For some people, if you've had vaginismus, tight pelvic floor muscles for years, they might not even do anything internal at first. They're going to work on your thighs and your glutes and your core just to start getting things to relax again. And you feel like you have a chronic yeast infection, so have a next generation test, urine test, to see if you do. Prove it in. Prove it in or prove it out. A next gen test will tell you once and for all if you have chronic yeast. Just go to bladderhealth.org, and you can learn about that now. If you believe you have chronic yeast, I double dog dare you to prove it. Have a test. That'll tell us. Because I'd hate for you to be delaying pelvic floor physical therapy because you think you're having yeast. I mean, could you be having yeast? Sure, you could be, but we don't know. You're guessing. So let's not guess anymore. Let's get the facts. Have the test. Let's see what it finds. Ralph says, what is a next generation test? A next generation DNA urine test is a new way that they test urine, where rather than growing it out in a culture medium, what they do is they look for pieces of DNA and RNA. And this is what is driving all of the new research right now, all the biome research right now, the urinary biome, looking for chronic bacterial infection, chronic fungal infection, chronic viral infection. All those COVID tests use next generation urine testing. So what they do is they get a little tiny sample. I mean, it's a little tiny sample of urine. And then they pull out DNA and RNA, and then they compare it with national databases to identify what you've got. And it will tell you good bacteria, it will tell you bad bacteria, it will tell you fungus, and it will potentially tell you virus if you order the viral infection. That's a higher type of urine test than the typical one. But next generation testing is the future. It identifies far more. And if you go to a website, bladderhealth.org, there are a whole bunch of videos of doctors who use it. The MAP Research Network is using it in almost all of their biome studies now. It is solid. The problem is local doctors don't really know about it, and or worse, their insurance might not cover it, so they'll poo-poo it. You call the company and order it. It's $199. They send you the kit. You take the slip to your doctor. You have your doctor sign off of it. You do your own urine sample, and you send it back. It is covered by Medicare. It is covered by some health insurance companies, but not all health insurance companies. So again, go to bladderhealth.org and you can learn about it. And yes, it shows yeast and bacteria. There are lots of different next gen tests. So, all right, guys, listen. We've been at this for over 3 hours, 3.5 hours. I have a couple of surprise gifts. So this is what I'm going to do. For our giveaway today, all I want you to do is email me your mailing address, and I will either send out a couple of gifts, or I will send out some back issues of our magazine, because I have a stack of that I'm just letting out into the world. They're good. So if you would like a stack of magazines and or a surprise gift from the IC Network, please send your email address. Please send your snail mail address to me. My address is icnetwork@mac, M as in Mary, A as in Apple, C as in Charlie.com. And I will be happy to send you a few things on the house. It is time for your homework. You have 4 pieces of homework. Number 1, do something for 15 minutes a day for your spirit and for your heart, because you're working hard right now. And you need a little rest. You need a little spiritual comfort. So whether that is going to church or reading a book or sitting outside in the sun with your eyes closed, listening to birds, whatever, do something that would give you comfort. The second thing I need you to do is 15 minutes. I need you to please read something credible like this book. Come on, 1 chapter a day. You can do it. This is going to teach you more than anything else you can read online. This is a fabulous book that will help you solve the mystery of your pelvic pain. For 15 minutes a day, I need you to do something for your bladder and or your pelvic floor. Do your exercises, please. Follow the diet, please. The email address is icnetwork@mac, M as in Mary, A as in Apple, C as in Charlie.com, or and the book is on the website is bladderhealth.org. Bladderhealth.org. Good, Ralph. I'm glad you ordered it. I think it's really important. Yeah. Okay, and last but not least, for 15 minutes today, please, I need you to laugh. And it's hard right now. I know 2020 is just the worst of the worst of the worst of the worst years in our country. I mean, I think that this has been probably the worst year in our national history, other than declaring war. Now we're at war with the virus. And so understand that when pain is accompanied by stress and tension, your brain will magnify that pain. But if pain is accompanied by laughter, your brain will minimize that pain. So you have my absolute permission to watch funny videos. If you want to watch TikTok, go for it. Something that will make you laugh. I actually deleted TikTok off of my phone because I'm addicted to it. And I can just sit there for 2 hours and watch TikTok. And there's something about how that's affecting my brain that's really bothering me. So I am actually, even though I'm going to make some TikTok videos, I hope for IC, I didn't like how it was sucking me in and just consuming me. I literally couldn't put it down for an hour or two. Yeah, I have deleted TikTok, but you have my permission to watch animal movies or anything like that. All right. Okay, guys, last call for questions. Otherwise, I'm going to shut it down and go eat something because I haven't eaten anything all day. Brenda says the happy baby yoga position. That's so good. It relieves severe spasms. That's right. So happy baby, you're laying on your back. You got your knees up like you're having a baby. And that will put your pelvic floor in a great position. Or you can squat down and put your butt on your ankles and squat down. That also, the prayer pose. The prayer pose is also very good for putting your pelvic floor in the right position. Carol says, I thought it was a drug, but it could have been it was probably the coffee, hun. Really. All right, my friends. I will see you now next Sunday. It's my birthday. And I'm intending to do a support group meeting. But that might change. We'll see. I want to try to get my whole family on Zoom and play poker or something too. Normally we do games on my birthday or go to a movie. We can't do that this year. So I'm going to be thinking about it, but I will be around. All right. Okay, guys, I'll see you later. Goodbye, Facebook. Whoops. I'm ending Facebook. All right, YouTube. I will see you guys later too. Have a good one. Bye-bye.